Good morning. Welcome in, everybody. Thank you very much. Appreciate it. Murch Church is about to come at you. Please share this out. Just sent the link out on X, on Twitter. Let people know you're about to be hanging out on Murch Church. Like this up as well. Really helps us out here on YouTube. And the higher ups seem to enjoy that in the old algo. But yeah, let's go.
Kevorkian adapted a mechanism whereby a string was put around the index finger of Thomas Hyde, and that all Thomas Hyde needed to do when he was ready to die was move his finger, pull the string, and that could start the flow of gas. The gas itself was turned on, not by Thomas Hyde, but by Jack Kevorkian.
Ladies and gentlemen, Murch Church is on the air Sunday morning, 9:06 a.m., slightly late. Doing a little bit of running around this morning, but I've made it. Thank you all so much for being here. Appreciate the hell out of it. About to look and see who's hanging out in the chat here. Ain't even had time to do that. I ran down here, and then my computer messed up. I had to restart the computer. Sometimes my camera and OBS don't want to sync up for some reason. I have to do a full restart, and today was one of those days. We're here, though, baby. We're here. It's early. Ready to rock and roll. One thing I need to do is I think it's this. Boom. Get this in there so I can pop. Boom. Those names up there. Oh, yeah, it's a little chilly down here in the old basement. I actually just turned the heat on when I woke up. Jay, what's happening, brother? Thank you for coming through here. I am not T-Pain, Disney Nerd, Sheila, as Dan would say, Bonnie Bailey, P. Fox, Dizzy, Donnie coming through here, hot and heavy this morning. What's going on, brother? Denise coming through here, Sarah coming through here. What up? Teresa coming through here this morning. Jersey Jen. Viv coming through here this morning. Saw Viv reach 2K on YouTube. Congratulations, Viv. She was giving a shout out to me and Jay, but I think a lot of that is because of you, Viv. You're absolutely hilarious. You're amazing. You capture these folks yourself. P. Fox, if I did not name you, welcome in. Regular right there. All the regulars coming through here, actually. Lily. Awesome. Good to see it, guys. We always have a lot of new folks. Kathy coming through here. New folks come through on Murch Church. Because it's always an interesting subject. This is week 2 of the Dr. Kevorkian trial. We're going to be putting in a little bit of time today. This first video, Chief Medical Examiner Dr. Bader Casson takes the stand. It's an hour 32 straight out the gate. But I'm going to do a little bit of plugging right out the gate. You know how we do here. Really because we got some new merch. And, oh, man, I saw Charlotte actually say something earlier. Charlotte, what's going on? I think she's not in the chat at the moment. She's at a rugby match, which is fucking dope. But I've got your merch. Right now, the new situation with merch that I'm doing, we don't ship outside of the United States. If you want something, let me know personally. PubliclyBuzzed@gmail.com. I will get that, and then I will figure out what the shipping is flat out. Not me making extra, and I'll get that to you. But I did want to, been messing with these right here, show a little bit of this, the Murch Church Before Adulting shirt. I thought that was a pretty dope shirt. And then these two right here. This is actually what Charlotte ordered, man. She ordered the Dr. Jack Kevorkian and the Jeffrey Dahmer book, and I've got those upstairs, and I'm going to bring those down in a moment. Whenever I go back upstairs, they are freaking sweet. Like, they're really, really cool. And, of course, I actually ordered one of the Murch Church beanies for myself. But, yeah, the new merch is shipping out super fast. The old merch that I was getting is I just got some older stuff, some orders that had come through. You know, that is about to go out Monday. So I actually messaged a few of those folks, prepare. And a lot of shirts, there were some folks that had won numerous shirts. I think there was 5 shirts that are going to be going out that were winning shirts from a Halloween contest that I had. So rocking and rolling, baby. Appreciate it again. Love it. Love it. Love it. You know what we're going to do? We're going to hit the motherfucking bells real quick is what we're going to do. Gotta start it off right. Right. Welcome in here. See Kaylin coming through here. Adam coming through here. What's up? What's up, guys? Thank y'all so much. Again, this is a heavy one. This is a very heavy one. I preferenced it last week. You know, religion could come to play into this. Just keep the chat respectful. That's all I ask. You know, differing opinions is welcome. It's cool. You know, just don't attack anybody else for their opinions here. So again, it gets a heavy subject matter, assisted suicide. But we're going to go in here. This is, again, second week starting out. Let's go.
I'll just pass them back to the prosecutor there. Okay, let the record reflect that the jurors have had the opportunity to look at exhibits 1 and 2. Mr. Kinney, proceed, please.
Thank you, Your Honor. Good morning, sir. Would you please tell the court, tell the members of the jury your full name and your present occupation?
My name is Bader Casson, and my occupation is that of a physician.
Would you tell us by whom are you employed, sir?
By Wayne County.
And what is it that you do for Wayne County?
I'm the chief medical examiner for Wayne County.
Would you tell the jury, please, what the medical examiner's job is?
The medical examiner's job in Wayne County is twofold. That is to say, the chief medical examiner's job has both administrative and professional responsibilities. The professional responsibilities are to investigate individual causes of death and to certify those deaths as to cause and manner. The administrative responsibilities have to do with the direction of the entire office and the staff to make sure that the requirements of Michigan law in the investigation of all unnatural deaths or deaths assumed to be or suspected of being unnatural are investigated.
Dr. Casson, do you have any special kind of training for what you do with the medical examiner's office?
Yes, sir.
Tell us what that special training is, please.
The special training consists essentially of training in the field.
Oh shit, bells were muted? What the hell? I just got those on. Hold on. Oh, I think I know why. One sec. My bad. We got to get the bells going. Sorry about that, guys. It was with this restart. We've got to re-put it back in, and now there's the bells. There's the bells. Official start of the church morning. I apologize. If you're new to Publicly Buzzed and to Murch Church, you're going to find out real quick. I'm a little bit all over the place. But yes, there you go. Boom, man, that's a nice-ass mullet. That is a nice-ass mullet right there in the front, out the gate. You got to start your morning out with a nice mullet sometimes. You hear Dan on Friday? Dan wants a mullet. I think Dan should go all in on a mullet. That's what I'm saying.
Field of pathology.
Damn, did I miss any more? I don't know if I missed any more, but here's my new favorite. Any old classic Martin fans out there? Huh?
Respect my house.
Ah.
Just chilling.
Just chilling.
Both anatomic and clinical pathology, as well as a fellowship in forensic pathology.
Would you tell the jury, please, what's pathology?
Pathology is a
true.
specialty of medicine that
This is
focuses
true.
upon the establishment of diagnoses, which means the identification
I've got to
of
fix
disease.
I've got to fix Jay's Stream Elements thing. I got to get the JBN channel in there.
And the description of that disease for practicing physicians who actually take care of patients. Pathologists usually work in laboratories, interpreting biopsy specimens, as well as doing tests on body fluids, blood, urine, and so on. Pathologists also teach in medical school.
I believe you also made reference to the field of forensic pathology.
I did.
What is that, sir?
Forensic pathology is a subspecialty of the field of pathology, which focuses more narrowly, after the training in pathology in general, on the identification and discussion of injuries.
And that's what you do now, is that correct?
Yes, sir.
Part of your duties, I take it, with the Wayne County Medical Examiner's Office is to perform autopsies?
Yes, sir.
And you want to stipulate? Do you want to stipulate to it?
Oh, I stipulate to his expertise, Your Honor.
Okay, fine. Yes, as a forensic pathologist, yes.
Under the jury, essentially what that means is that rather than have the doctor testify to the expertise and qualifications and his background and so forth, the lawyers are agreeing that he has that background and expertise, and a stipulation is an agreed upon fact between the attorneys. Okay, proceed.
Dr. Casson, I want to direct your attention to August the 4th of 1993. Were you working at the medical examiner's office that day, sir?
Yes.
And on that day, do you recall whether an individual identified to you as Thomas Hyde was brought to the medical examiner's office in a van?
Yes, sir.
I'm going to show you what's been marked as People's Exhibits 1 and 2 and ask you if you can identify what I've just handed to you.
You've given me two photographs.
Yes.
One is that of a van photographed from the left rear, and the other is a photograph inside the van, this time taken from the front of the van, pointed backwards, displaying on a bed-like structure a body covered by a sheet.
Do you recognize the body that's shown in exhibit number 2?
I can't make an identification of the body, but it is the appearance of a body that I saw on that day.
Okay. That being Thomas Hyde?
Yes.
At the time that you saw Thomas Hyde at the Wayne County Medical Examiner's Office, could you describe, please, exactly how he was positioned?
The body of Thomas Hyde was positioned on his back. The arms were slightly folded. The legs were outstretched and somewhat spread apart. The body was clothed in 2 pieces of clothing, sweatpants and a gray T-shirt. The body, as I said, was lying on its back and was covered in addition by a sheet that was drawn up to the neck and covered the feet. And over the face there was a clear plastic mask that covered the nose and mouth. From that mask was a thin, clear plastic hosing that was connected to a metal tank that was positioned down on the floor behind the head of Mr. Hyde's body. Connected to his forefinger, his index finger, was a small string, and attached to that was a paper clamp.
Okay.
There was no jewelry on the body, no other personal effects.
Now, Dr. Casson, once you first observed Thomas Hyde in this van, can you tell us what action, if any, did you take in your capacity as a medical examiner?
I examined the body quickly to ascertain whether there was life or not, and having found no evidence of that, I directed the recovery of the material that was relevant to my investigation, principally the body. That first of all meant that the hosing and the mask had to be removed and the sheet taken off the body. The body then, in its clothed condition, was removed into the interior of our building for further examination.
Now, Doctor, many of us have seen TV detective shows where they talk about medical examiners or coroners determining time of death. Were you able to do that in this particular case?
Without further information, I'm at the mercy, if you will, of physical findings. There are no physical findings that can tell us exactly the time of death. All we can do is estimate based on those observations we make. If, in fact, someone was present at the time of death and can say that with good reliability, or if there is other evidence that comes forth, then perhaps more accurate establishing of the cause of death can be done. But given only the body and no other information, we are left to those observations. In this case, I made observations that gave me a general idea of the time of death.
Okay. Is there some particular reason why you can't be precise about the time of death when you look at a body?
The most valid reasons are that a body after death, just as during life, continues to change. And after death, those changes are progressive, but they depend upon environmental influences. They depend upon the condition, first of all, of the body during life. If there was certain disease present, or infection, for instance, whether there was fever. Also, they depend upon the environmental influences that are external, outside the body. For instance, temperature, humidity, exposure to sunlight, that sort of thing causes changes in a body in a progressive way, but all dependent upon those internal and external influences. And so that what one is left with are a certain condition at a certain period of time that allows one, at least in general, to extrapolate or think backwards along a timeline that is rough and to make some estimate of the time of death. But the exact time of death is not, at least now, known to be measurable.
Given what you had observed and found on August the 4th of 1993, were you able to come up with any sort of estimate regarding time of death?
That's the equivalent of asking Dr. Kassem, who I respect greatly, to guess. And even though I acknowledge his expertise...
A person with that expertise and qualified as expert more or less are allowed to do.
Well,
I mean,
no.
it may not be the right word, but they are allowed to give an opinion, based on expertise.
Absolutely. I'm not objecting to opinion, but Dr. Kassem is indicating that his opinion would simply be a guess. Now, it's one thing to have an opinion based upon a foundation, and for instance, a reasonable degree of medical certainty. But Dr. Kassem has already testified that that foundation, a reasonable degree of medical certainty, cannot be, because the facilities don't exist for that, he cannot make such testimony in regard to time of death. Therefore, he would simply be guessing. I don't object to him giving an opinion based upon a reasonable degree of medical certainty. I don't disagree based upon his expertise or anything, but simply because he's an expert doesn't allow one to guess. It allows one to base their opinion on foundational facts or background or expertise. And in this case, Dr. Kassem has qualified everything assiduously to say, notwithstanding all my expertise and notwithstanding the best work that I can possibly do in that area, I'd be willing to guess, but it would still be a guess.
All right, Mr. Kenny, you have a response you want to make to any of that?
Yes, Your Honor. I think that this expert, as part of his field with regards to determining cause, manner of death, is entitled to give us his approximation, if he can, as to time of death and the weight of that or the value to be given to that particular answer is for the jury to decide.
I would agree. What we have here, I think, is a question of weight rather than admissibility, and certainly I find that what he says, though certain words may be used, they still come to the same conclusion, that is that he may offer an opinion as an expert, and that can be weighted, of course, in cross-examination as you wish, Mr. Feiger, but proceed.
Okay. Dr. Casson, given what you observed and what work you did in your capacity as a medical examiner, were you able to formulate an approximation as to the time of death, or within what time period?
Based on my observations, I could give you a range. It's unfortunately, perhaps for your purposes, broad, but I would estimate that the body had been dead at least 1 hour, but that it could have been dead perhaps as many as 4 or 5.
Okay. Now, can you tell us, please, Dr. Casson, do you recall what time it was that you received the body or first saw the body at the medical examiner's office?
I don't recall exactly, but again, I can estimate that it was at approximately 11 o'clock.
And when you say 11, are we talking about in the morning or the evening?
In the morning of August 4.
Dr. Casson, once Thomas Hyde's body was brought into the morgue, did you perform what's known as an external examination of the body?
Yes, sir, I did.
Tell the jury, please, what's an external examination during the course of an autopsy?
An external examination is an observation of those features that are present on a body on its outside surfaces. So we're talking about the appearance of the eyes and the hair and the skin and the general configuration or shape of the body. And this must be, of course, done not only with clothing but also without it. And so that was done.
During the course of your external examination of Thomas Hyde, did you make any noteworthy findings that had value to you in determining the cause or manner of death?
Yes, sir.
And tell the jury, please, what noteworthy findings you made during the external examination.
I would summarize them as saying, first of all, that the body was still warm, that although it was stiff, it was only slightly so. This is a change after death called rigor mortis. That is a progressive change. It comes on slowly and progressively becomes more firm. That change was there, but it was easily overcome. And so I would have I did estimate it as being early rigor mortis. Blood had begun to settle in the body to the point where I could begin to see it settling. This is a change called lividity. And that likewise was easily expressed away from the area that I examined it in the skin, meaning that it was unfixed, and therefore it was likewise an early post-mortem change. There were 2 articles of clothing, as I said, and those articles of clothing were not altered in any way that would make me suspect that there was any violence associated with contact with that clothing. The one notable thing observation that I made was that there was perspiration still present in the gray T-shirt, and that was on the back side of the T-shirt, that which was in contact with the back of the body and the surface of the bed. On examination of the skin surfaces, there were 2 important observations. One was a negative thing, that is to say, I did not find evidence of injury, no scrapes, no bruises, no holes. No unusual findings in the skin that would lead me to believe that this person was in some way violently abused, or that he himself had done something violent to himself, producing injury. The positive thing that I found was that the lividity that I have mentioned before was bright pink. It was not a dark red, as is more customary. It was a bright pink in color, and that the muscle mass especially in the upper extremities, in the hands, the forearms, and the hands, appeared to be less well developed, or in an adult, as this person would be, not used. They were atrophic. It appeared as though the muscles had diminished in their usual volume, so that by looking at a lot of hands, one gets a certain impression of normal muscle mass underneath the skin, which gives it usual contour. What impressed me was that there was less than normal muscle mass between the fingers and the hands and in the lower forearms. Those were the most relevant observations, I believe, that I made.
Once you had performed your external examination of Thomas Hyde, as part of your normal autopsy procedure, did you then perform an internal examination?
Yes, sir.
Tell the jury, please, what does the internal examination consist of?
The internal examination is similar to a surgical procedure. It is an opening of the body that is done in the front of the body so that all the organs can be examined individually as well as all together, and that certain specimens, both liquid and solid organ tissue, can be removed for further testing, both microscopically as well as chemically. The internal examination typically consists of looking at all the contents of the chest, the abdomen, the head, and the neck.
Dr. Kassim, could you tell us, please, did you make any noteworthy findings at all during the course of the internal examination?
Yes, the noteworthy findings are easy to summarize, and they are that the body of Thomas Hyde appeared to have normal organs. I did not find the evidence of infection or disease. I found only terminal change, that is to say, the changes that are typically associated with dying the last few minutes of life. But other than that, the organs appeared normal to me. There was one exception perhaps to that, and that was that the brain, although it appeared normal, both whole as well as cut in a typical scientific fashion, was swollen and was considerably swollen, which is generally interpreted as a toxic or reactive change, or a reactive change to some kind of physiologic abnormal environmental influence.
And once you had finished your internal examination, did you ever do any kind of microscopic examination of any of the body tissues?
Yes, sir.
And when you did that, did you make any noteworthy findings that affected your opinion regarding the cause and manner of death?
Yes, sir. My noteworthy findings on microscopic examination of representative tissues from all over the body disclosed, first of all, that my observations generally at first were true with regard to the normality of organs. They all appeared to be normal. There was one remarkable exception, and that was the condition microscopically of the spinal cord and of the brain stem, that connection of the spinal cord with the lower portion of the brain. In this area, there was degenerative change.
Now, what do you mean by that? What is...
Degenerative change means that there was a wasting or abnormal appearance of the cells of the spinal cord in a certain distribution that is associated with with disuse. Rather, the cells had died, basically, and were present in an appearance that was characteristic of a chronic, debilitating disease called amyotrophic lateral sclerosis.
Would that be known more commonly to laymen as Lou Gehrig's disease?
It is.
Could you define for us what Lou Gehrig's disease is all about?
I'll try to summarize it. Lou Gehrig's disease, or amyotrophic lateral sclerosis, or what sometimes is also referred to as ALS, is, as I mentioned before, a chronic, progressive, debilitating, handicapping disease. And the reason for that is that the cells of the spinal cord, certain cells of the spinal cord, for some reason, ceased to function and, in fact, die. This is associated with a loss, therefore, of a transmission of an impulse, a message from the brain to the skeletal muscle, the muscles that operate by voluntary, controlled activity. And these are the muscles usually that work our chest and abdomen. They work our arms and legs. They work the neck and the facial muscles and so on, but not all the muscles of the body. But the large muscle groups are indeed voluntary. And they're voluntary because the brain must be able to control them, send them messages. With the loss of these cells in the spinal cord, there is a loss of the ability to send that message from the brain, so that while the person with ALS does in fact wish, perhaps, to send certain messages, the ability of the brain to do that is handicapped to the point, first of all, where it only is an occasional weakness, but ultimately, and this may be within a year or two or three or several, there is complete paralysis, so that there is loss of function. But in the meantime, the intervening time, there is only partial control, so that a person does not necessarily have full strength. The effect of all of this is that while a person can think, while a person can have normal bowel and bladder and sexual function, there still is a progressive deterioration or loss of the control over skeletal muscle. So that while there is a sporadic, occasional weakness at first, over a period of a year or several years, there is a progressive increasing loss of more and more skeletal muscle control, to the extent that a person loses the ability to walk, loses the ability to support one's own strength, loses the ability even to move around the room under one's own power, and eventually loses the finer motor activities, the ability to swallow, the ability to breathe, the ability to speak coherently, to control one's tongue.
Dr. Kassem, can you tell us, please, is there, based on your knowledge and experience, any average life expectancy with regards to people who are first diagnosed with ALS?
I can tell you that from my reading and discussions with regard to this disease, that there is an average time generally quoted of not greater than 3 years from the time of first onset of symptoms to the time of death. So this varies, as I mentioned before, to perhaps as little as a few months or a year, to as much as a number of years. And that happens because in certain individuals, the progression of the disease is temporarily halted, but it never reverses.
And is this a disease that's always fatal?
It is known always to be a fatal disease, and it is associated with the debilitation, the inability to control one's secretions, the inability to breathe. So most deaths occur by infection or the loss of the ability to control the breathing muscles.
Okay. What type of infection are we talking about?
Usually the infection is the most common type of infection that kills, and that is pneumonia.
Now, is there a medical specialty or subspecialty that deals with patients who suffer from ALS?
Yes, sir. The medical specialty of neurology is the specialty that usually makes the diagnosis and manages patients with this diagnosis.
And do you have any expertise or specialty in neurology?
No, sir, it is not my specialty.
Now, Can you tell us, please, is there any ongoing pain of a severe nature that frequently occurs with people who suffer from ALS?
I suppose the most accurate way to answer that is to say that physical pain is not necessarily a part of this, nor is it characteristic of this disease. But you did say that patients suffer, and I would say that that is true, but the suffering is one of frustration and psychological handicap.
Okay.
That mirrors perhaps the inability to control one's body.
What about with regards to things like muscle spasms? Is that anything that occurs to, as far as you know, with regards to those who suffer from ALS?
Yes, sir. Whole muscle groups do not lose their innervation or message receiving ability from the brain at one time, so that, first of all, messages from the brain become fragmented, they become disorganized, and the messages get to skeletal muscle and are communicated thereby through lack of control. So there may be twitching, there may be spasm, which is an uncontrolled contraction of muscle that may produce pain, but not always. The most remarkable effect is simply loss of coordination.
Okay. Anything doctors prescribe in terms of any medication for the muscle spasms?
Yes, sir. I'm not entirely familiar with the exact drugs or the times that they are prescribed or the dosing schedules, but I can say in general, yes, there are drugs prescribed. There are drugs that tend to diminish the unwanted side effects of the disease, but they do not treat the disease directly. They are directed toward the symptoms of the disease.
Okay. Now, can you tell us, please, did you do any other testing with regards to Thomas Hyde in connection with this autopsy?
Yes, sir. In our office, we also did chemical testing on certain biological fluid specimens that were taken at the time of my examination of the body.
And what tests were those?
The testing that was done, and if you'll allow me to refer to my laboratory report, I will be able to tell you that specifically the testing was done on specimens of blood and urine and vitreous humor, which is the fluid present in one of the chambers of the eye.
All right. With regards to the testing that was done on the...
to Brooklyn, the Tales from the Crypt episode, I'm going to have to find it, and I want to find it so I can get the actual name of it, but so essentially this guy, thinks that he's dead, right? Like his colleagues are playing a trick on him. And they've put like basically a drug inside of him where he's mentally still functional, but his body is just paralyzed. So, but here's the thing, they go through, so he thinks he's dead. Like they even the drug makes him have induce like a heart attack or something. It's super morbid. But mentally he's still there, but he's just out, he's gone. And they're like, all he hears is like the voices of everyone saying, oh no, he's gone. They put him in like a cooler, right? He's like, oh God, what's going on? They put him on the hook, they don't actually put him on the hook, but they make him think that he's on the hook. And they actually put him on, it goes as far as putting him on, the gurney or the board or whatever, into getting ready to actually embalm him, and he hears like the saw get ready and he hears all the voices. And it's actually for like a student, the students are there who I guess are going to be doing this as a job. So it's fucked up, but you don't learn that they've paralyzed him and that's happening till the end. So you're watching this just going, holy shit, what if our brains are still functional when we die? And it's very messed up, and it's always messed with me, even though at the end it's like, we just induced a heart attack on you. It's just jokes and laughs, and paralyzed your body for over 24 hours. Everything's fine now. But that always messed with me. Like, if we die and our brains are actually still functional somehow, which I know that's not how it works, but let's just say Tales from the Crypt fucked me up. Your parents are probably right.
Blood and urine, could you tell us, please, did you come up with any noteworthy findings regarding those chemical tests?
Yes, sir. In general, I can summarize those noteworthy findings as two. First of all, in the testing for alcohol and other drugs of abuse that are in common use and abuse in this, as well as in this county, as well as throughout the country, as well as for certain medication groups. All tests in blood and urine were reported as negative, which is to say that none of those substances appeared to be present in blood or urine or vitreous humor. The one positive finding that was reported as being present and was measured was the toxin or poison called carbon monoxide. This was present in a concentration of 88% in the blood.
Now, such a percentage of that carbon monoxide poison, what significance does that 88% have? Could you tell the jury, please?
The significance of carbon monoxide, first of all, is that it is a poison, as I mentioned. Essentially what it does is compete for a position on the red blood cells in the bloodstream. What it does is preferentially take the position on the red blood cells that would ordinarily be given to oxygen, so that blood cells that travel from the lungs to all the other organs of the body and carry oxygen as well as other chemicals, but oxygen from the lungs to all those other organs are poisoned. They lose their ability to carry oxygen to the other organs of the body, so that the other organs will therefore lack that essential nutritional element and therefore die. Cells are like bodies. If they cannot breathe, they die. Carbon monoxide is a toxin or poison that does this. A concentration of 88% is beyond the concentration that is necessary for someone to die.
What's the normal percentage, if you will, in terms of a fatal level of carbon monoxide in the system?
In our experience, people with greater than 30%, although in some few cases it's less, but in most cases with greater than 30% carbon monoxide are dead of carbon monoxide.
Oh shit! I found that episode. It's called Abracadaver, and it's season 3, episode 4, and it's actually, like, you know, as voted on as of February 9th, 2023, the scariest Tales from the Crypt episode. It fucked me up. Like, it's always stuck with me, which sucks because, like, you know, and I realize that's not real, but in my head it's always like, fuck, man, I don't want to, like, still be here if they're gonna be doing all this shit, right? But it's a really good one. It's fucking good. I'm gonna watch it on Kick. I'll watch it on Kick.
Poisoning.
Based on your knowledge as a forensic pathologist, sir, do you know carbon monoxide to be used as any type of medication for treatment of ALS?
No, sir.
And what about carbon monoxide being used as a pain reducer or pain treatment?
No, sir, I'm unaware of that.
And is there any particular reason why it wouldn't be used in such a fashion?
Because it's a poison. Its effect is primarily upon the most sensitive organ in the body, which is the brain. It eliminates consciousness and produces death within minutes. And I expect that its use, therefore, as a palliative drug, a drug to relieve certain physical symptoms without doing further damage, is very limited.
Now, based on your examination at the morgue, Did you come to a conclusion that the carbon monoxide came from the canister that was in the van, through the tube, in through the mask?
You couldn't watch Tales from the Crypt, but your first embalming visual was at 3 years old? What?
That was my assumption. It happened to be there. There was a percentage of oxygen in the canister that at least
It stuck with me.
it was prepared that way. I don't know if there was any upon our examination, but it had been prepared with carbon monoxide. There was a continuous flow route to the mouth and nose. I did not know of, or was I made aware of, any other way that the person, Thomas Hyde, could have taken that carbon monoxide. So frankly, I made the assumption that that was the route.
If the carbon monoxide had been taken in the route that you've just described for us, could you describe for the jury, please, if someone were conscious and breathing carbon monoxide through a mask such as the one that you saw, what would happen to someone as they breathed that? Do you know?
Objection. What's the no foundation? He's got to first describe his experience with patients breathing carbon monoxide, or at least describe that expertise before he testifies to something he doesn't have experience in.
Why would it be necessary to do that if he is describing the effect of having, if that occurs if you have the mask on?
To my knowledge, there are very few physicians in the world who have experience with that. Dr. Kassem would, in fact, have to come to Dr. Kevorkian to find out what happens, because, to my knowledge, since I'm very familiar with Dr. Kassem, he's never had he's never read any articles on it, and he's never done it himself. So how would he possibly testify to something he's never done? It's like asking him to testify about a brain surgery when he's never done brain surgery.
All right. Your response to that, Mr. Kenny?
Your Honor, I don't think he has to be specifically familiar with that individual procedure. I think as a medical examiner, if he knows, he can tell us what the effect of carbon monoxide would be on an individual if breathed through a mask.
That's not my objection. I'm sorry. He can say it. I think he's already said it. He said it's a poison and it will eventually end your life. But if he is now going to start telling us what happens at certain stages, and with no criticism of Dr. Kassem at all, I know he has no familiarity with that. He couldn't possibly testify to it without establishing his foundation. You can't just go up on the stand and say something. And so if he's just asking generally, if you breathe carbon monoxide through a mask, will you die? I don't object. But if he's proposing to go through a staging, which Dr. Kassem isn't familiar with, and just asking Dr. Kassem to make up testimony, that's what I'm objecting to.
Your objection is noted. However, Rule 702 does say in general, if the court determines that recognized scientific, technical, or other specialized knowledge will assist the trier of fact to understand the evidence or to determine a fact and issue, a witness qualified as an expert by knowledge, skill, experience, training, or education may testify thereto in the form of an opinion or otherwise. Over the objection, I will allow that question to be asked, please.
Just for the record, my objection doesn't go to 702. My objection goes to MRE, I believe 703, bases of testimony by experts. The facts or data in a particular case upon which an expert bases an opinion. The court may require the underlying facts or data essential to the opinion to be in evidence. And that is the foundation which I'm objecting to.
Okay.
I'm not objecting to 702.
All right. Even with 703, then, over the objection, I will allow it. Go ahead, please.
Donna Minor coming through here. Said that right, didn't I? Minor. Yeah. Donna Minor, right? Pastor Steve, you the best. $4.99. Thank you very much. Appreciate it. Hell yeah. Hitting you with the new one. Hitting you with the loud enough. Everybody's got a price. Anybody that used to watch old WWF got to know the Ted DiBiase theme song. Give me the loot. Give me the loot. Appreciate that, Donna. It's awesome as hell.
Dr. Kassem, please tell the jury, if you could, please, what would be the the physical effect of someone who is
Minner, Donna, Minner. Like dinner. Minner.
is breathing carbon monoxide through a mask such as you observed.
I got it. I'm coming into the chat. Don't make me step through this computer screen.
The physical effect, to continue the prior discussion, would relate to what is actually scientifically, chemically, biochemically happening. And that, again, is that even though the blood cells
Minner like dinner.
are streaming through the body at the regular rate, they are carrying less and less oxygen from the lungs because the oxygen carrying capacity of those red blood cells is being overtaken or poisoned, eliminated by the presence of carbon monoxide. And so the effects of carbon monoxide poisoning are essentially what one would experience if one had less and less oxygen, progressively less oxygen available. As I mentioned, the effects are found or felt in every organ of the body, but what is experienced by a person could reasonably be limited to the condition of the brain, the most sensitive organ, so that within a very few minutes, a person's consciousness would diminish, the alertness would diminish, and eventually a person would lose consciousness or become comatose. Over a period of ensuing minutes, perhaps another 10 minutes or 15 minutes, the person would ultimately die when enough of the body was deprived of oxygen, including the brain. But the sensation that a person would have.
Oh shit. Hope Ain't Fear gonna gift out a membership. Who's gonna grab that bad boy? Kelly Gale. Boom. Thanks a lot, Hope Ain't Fear. Appreciate that. Beers in the chat. Crack one open. Welcome to the party, pal. OTB cranking in the fucking system. She ain't here, but we'll still try to get her. We'll lure her in with a little. What? Know what I'm saying? Know what I'm saying? And then I don't think Amber's in here this morning, but Amber is the color of your energy. Oh, it's one of those anyways. Thank you so much, Hope Ain't Fear. Appreciate that. And welcome to being a member here, Kelly Gale.
Would be limited to the first few minutes of exposure to carbon monoxide in sufficient concentration. And that would include, and this is from general experience of loss of oxygen from whatever cause, that would include perhaps no reaction whatsoever or no sensation whatsoever. A person might simply appear to fall asleep, and in fact, the sensation may be no more difficult or uncomfortable than that. However, those people who have been deprived of oxygen have also experienced certain other discomforts during those first few minutes, and that would include nausea or perhaps restlessness, irritability, maybe even muscle tremors, but that would be limited to those few minutes.
Okay. Did you find any other drug concentrations or any other concentrations in the blood other than the carbon monoxide you've described for us?
No, sir, there was nothing else present.
Okay. Now, Dr. Casson, once you had completed all of your examination and all of your work involving tissue samples and toxicology exam, were you able to reach an opinion within the best limits of medical certainty as to the cause of death of Thomas Hyde?
Yes, sir.
And what was your expert opinion, sir, as to the cause of his death?
Thomas Hyde died of carbon monoxide poisoning.
And how did you rule the manner of his death, sir?
I ruled the manner of death as suicide.
Thank you, sir. At this time, I have nothing further.
Hold on just a minute, Mr. Feige, while the court report is set, please.
All right.
Go ahead, please, Mr. Frank.
Dr. Kassem, I think you described very vividly and poignantly the manner of death and suffering from by a person who suffers from ALS in terms of the degeneration of the muscles. What happens to their brain? Is the brain affected at all?
To my knowledge, sir, the brain is unaffected completely. The person, in other words, has the same thought processes and the same wishes and same desires and that he might have if he did not have this disease at all.
So a patient, in other words, who is losing control, as to use your words, of their body, is fully mentally aware of those losses. Is that correct?
Yes, sir.
And indeed, it must be very terrifying for a fully conscious and aware person to begin losing the ability to swallow and to breathe. In other words, to feel like you're choking or suffocating.
I think that would be a common understanding.
Have you done any studies, or you're aware of any of the terror that patients suffer when they enter that phase of the disease, when they're fully mentally competent and they begin to experience periods of suffocation or inability to swallow and choking?
No, sir, I've not studied that.
What kind, other than, what would relieve a patient of that terror, that psychic pain of losing control over your body and suffocating and being unable to swallow? What would relieve that terror?
As a physician, even though I've only participated along with others specialized in that field in the care of people with that disease, I'd be at a loss. I don't know of a medication or any natural physical thing that one could, or way a person could be treated to be relieved of that.
Certainly when Tom Hyde died, that terror was gone. Is that correct?
Yes, sir.
Your Honor, I have a matter to bring up outside the presence of the jury at this time. May I do so?
Yeah, member of the jury, why don't you just go to the jury room just for a few minutes? I wanted to try to get through with the doctor before we had our lunch break, so I want you to stay close for the time being, but just go to your jury room.
All rise for the jury.
Please see that Mr. Frank working the juries are out of the courtroom.
Your Honor, in this case, the statute requires the prosecutor to prove beyond a reasonable doubt that administering a procedure, that the intent in administering the procedure was not to relieve suffering or pain or discomfort, even though the procedure may hasten or increase the risk of death. In this case, obviously, the court and Mr. Kenny are well aware of the fact that that is one of the essential elements of the statute and one of the essential elements of our defense, that the prosecutor, that is the intent of Dr. Kevorkian, and that was the intent of the procedure, and that is what it was utilized for. There is in possession of the court now and myself a videotape which vividly describes the pain and suffering, the then existing emotional and physical suffering of Thomas Hyde prior to his death. In order to adequately defend Dr. Kevorkian against the charges, and Dr. Kassem has testified, and Mr. Kenny, in fact, opened the door and discussed what Thomas Hyde was suffering from, among other things, beyond the terror, was the acute muscle spasms that would cause him to ache in pain. That is portrayed on a videotape, and therefore it is essential to my defense to display that videotape to the jury. Now, I know that the court has indicated, and I thank the court, that Heidi Fernandez and others, if they're familiar with it, would be able to testify as to the things brought up by Mr. Kenny and Dr. Kassem and myself during opening argument. But when we have a videotape of the suffering itself, the jury could not possibly be better informed than that. And it was always Mr. Kenny's argument to this court prior to the opening of this case that the playing of the videotape was irrelevant. I didn't wish to disclose my defense strategy, but having disclosed my defense strategy now, at least in part, as to the statute itself and as to the intent of Dr. Kevorkian and as to the significance of the tape with regard to Thomas Hyde's suffering, Mr. Kenny cannot possibly now continue to make the argument that it's irrelevant. In fact, it denies Dr. Kevorkian a fair trial if we have a videotape of his suffering, if the defense is that he had the intent to relieve the suffering, even though it hastened death, and we couldn't portray it better. The only claim, I guess, that Mr. Kenny could make at this point is that it's more prejudicial than probative. And it's not prejudicial only in the sense that he is correct. His intent all along in attempting to deny the jury the opportunity to view the videotape was to make it so the jurors would not be sympathetic to the defendant. That's not a claim for prejudice. Prejudice has to be less probative, that the probative value.
And we're going to get there. I'm doing all three of the trials, 94, 96, and 99. The 99 trial, which you can 100% watch the video on because you can go to YouTube and watch what they showed, whether it was 48 hours or 60 minutes. I forget which show it was, but you can watch the individual that he killed, which again was a Lou Gehrig's disease that this guy was suffering from. And his entire fear was that he would choke to death and die while he was eating. He was terrorized of this, because his mind was still very active. But you can see the video of that, and, Dr. Kevorkian is very open about, are you sure you don't want to wait another week, another 2 weeks, another month? Made him sign 2 different times. Like this guy, and even one day he came, had it all set up, convinced the guy to live another day, another week even, and then the next day his family called and said, no, he wants it now. He's worried now, and made him come and sign some more paperwork.
He was outweighed by the prejudicial impact. Here in this case, it's solely probative. It's the best probative evidence anyone could have. And Mr. Kenny is simply asking this court to tie my hands and prevent me from presenting the defense in this action. And now, I think I indicated to the court that I didn't want to disclose my defense. Now the court can clearly see it's right on target. I have to be able to do this. And Mr. Kenny's argument in a vacuum that it bore no relevance to this case is not only wrong, it's as if he didn't read paragraph 3 of the statute. I have to be able to show the jury what Thomas Hyde was suffering from.
Okay, let me stop you right here for a minute. What has that...
No way. If there's anybody in here eating unfrosted Pop-Tarts, I don't know what's going on. No, there's no way. I could not eat an unfrosted Pop-Tart, period. I would, even if that was all that was there, I'd probably be like, I don't know. I mean, I guess if it was all there, I'd scarf it down. But no, I like a frosted fucking Pop-Tart like a regular American. I don't know what the hell we're talking about here. I'm about to go get a Pop-Tart. Say no to globalism. $4.99 coming through. Love you, girl. Oh yeah. She's got one I like to play here.
This is gun country.
This is gun country, baby. Boom. Starting that Sunday off right. Appreciate it. Say no to globalism. And there's still about, 40-some minutes here left of this video. I'm going to go get some Pop-Tarts. I'll be right back. Welcome back, Joe. Hey, if you're not following Joe, I think I popped his name up there a minute ago. Make sure you are following Joe. He's been going live on the regular, bringing awesome guests. He had a JFK show yesterday, doing the damn thing. I'll be right back.
That got to do right now with...
I'll be right back.
The doctor, or your cross-examination of the doctor, you need that? Are you suggesting that you need to show that to the doctor for him to testify?
He's testified about... I don't want to keep Dr. Kassem here more than he has to, Your Honor, and I'll do it any way that he wants to. But Dr. Kassem has testified, I believe, absolutely correctly about not only the psychological terror, but the muscle spasms. These muscle spasms are portrayed on this tape. Thomas Hyde winces in pain and screams at certain points during this
Mr.
tape.
Frank, let me interrupt you again, please. That may very well be what I'm asking you right now. Are you asking the tape to be admitted in order for your to cross-examine the doctor regarding something on that? Is
Yes,
that
I
what
was
you're
going
saying?
to ask him about the physiological symptoms that are portrayed on the tape and ask him to comment to the jury, just like Mr. Kenny did, about the physiological symptoms. What the tape displays, for instance, his agony with the muscle spasms. I can then cross-examine Dr. Kassem about that physical display of symptomatology by a patient.
Okay, I see what you're saying. All right, go ahead, Mr. Kenny. If we're talking about showing this right now, just in terms of the subject matter of the condition and what it reflects and what he's talking about, that can even be done without sound if necessary. So what's your problem with right now?
My position, Your Honor, certainly is that it is more prejudicial than probative. The actual videotape itself, whether it's sound or with sound or without sound, we would submit it is clearly more prejudicial than probative in this particular case. And could I address that subsection that's being referred to as part of the defense?
I guess so.
Okay. With regards to that subsection, I would call the court's attention to the fact that when you read that entire clause of that subsection, it talks about the section number 1 does not apply to prescribing, dispensing, or administering medications or procedures if the intent is to relieve pain or discomfort and not to cause death, even if the medication or procedure may hasten or increase the risk of death. That, I submit, Your Honor, is a provision that goes to physicians who administer medications or treatments that may be experimental, which the intent is to maybe relieve a cancer-suffering person's pain by using an experimental pain reliever, but not knowing what the impact is going to be. Maybe it is going to cause death, but the intent is to deal with this particular pain.
An argument that you make to me now as a matter of law, and all you make to the jury, in terms of like whether or not what is being done or was done allegedly by the doctor apply or doesn't apply or does not fit within that category. See, I guess what I'm asking, you're telling me what you think that means. That's your theory, I guess you might say, what you think that means. Is it as clear as you say it is?
Okay.
And say what I'm saying. In other words, because you think that it means that, or it should be interpreted as such, I think there's room, of course, I think, to disagree. But are you asking me as a matter of law to say that, well, I shouldn't allow testimony or a theory or of defense that says it doesn't fit that?
Yes.
Merely because you think that that's what it means, when we don't really have any guidance really as to what that means, do we?
Other than the legislative history, yes, Your Honor.
Frankly, I don't think there is much of a legislative history on this, Mr. Kitty. I asked the librarian earlier today to try to find as much as he could about that for me, and I haven't come up with very much, on it, not even a commentary, so far. But let me do this, okay?
Son of a bitch. I was muted, of course. Well, I'm eating Pop-Tarts. I'm showing off Kalen's credentials of ministry to certify me as an official pastor for Murch Church. On this day, December the 3rd, 2023. Let's go. Son of a bitch. Son of a bitch. I knew that was going to happen. I was muted it because I didn't want you guys to hear me chomping back here. Son of a bitch. Oh my God. Woo! Kayla, thank you very much. You still in here? Where'd you go? Oh my God. Oh my God. Yeah, there we go. Merry Christmas. Thank you, Kaylin. That's fucking dope. I love you. That's dope. Oh, strawberry, of course. Strawberry, sir. That's actually all I eat. I mean, I guess I would do a blueberry, but I like a strawberry. With the frosting.
I will give you an opportunity to argue that issue and make your record on that. I don't want to hold up just sitting here arguing this right now. I thought we were going to be able to, before the lunch break, finish with the examination, of the doctor. Certainly, if it's going to take time to talk about this, there's no sense in holding him up and just having you come back, doctor, I assume, or you can check.
I'm a crazy person, y'all. Yeah, I'm not very good at anything, quite frankly. Like, I don't... I barely make it through this
To
thing.
see if you have to come back after we have a break here and we can save the time. So we're talking about probably in the area about like between, let's say, 1:30 and 1:45 roughly. Okay? So why don't I just let that jury go now for the lunch break and have them back at about 1:30 or 1:45, and meanwhile we can discuss the legal issue that's involved with this, okay? So just please tell that jury, please, to go to lunch. Will you hold on, please? They're supposed to go on in the courtroom right now, please. Just hold on.
This thing is hitting right now.
Have that jury be back in the jury room at 1:45, okay? All right, doctor. I think there's probably no reason for you to have to stay right now if you don't, need want to. But very likely you may have to be back here at about roughly 1:45. But check back or call back, and we can better let you know. Okay. All right. Okay. Thank you. I want the lawyers to continue with the argument here.
In response, Mr. Kenny's asking this court to write into this statute, re-legislate this statute, and say that subsection 3 now should have been written to say it only applies to medical doctors for experimental purposes. Now, with all due respect, I don't think the jobs of this court is to rewrite the legislation. Prior to this legislation, which the court aptly set forth, this legislation was literally passed overnight. It's one of the reasons why the law has been declared unconstitutional by 2 different judges under the title object and the change of purpose rule, because virtually overnight, Section 7 was added into the statute. Moreover, Your Honor, it was added into the statute overnight without a debate, so there is no legislative history. And Section 7 is remarkably different.
I haven't had a toaster strudel in a long ass time, but I remember those being like the big deal back in the 90s on like cartoon TV, right? A good toaster strudel.
Then the first law that was passed that was to take effect in March of 1993, but when the legislature went almost nuts, Your Honor, may I approach the bench? I have Public Act 1992.
I have that.
270.
I have it.
And they changed subsection 3. They made the prior act was referred to a licensed healthcare professional. They took it out. And the intent was, because I think I was somewhat involved, is subsection 3 applied to everyone, even patients' families, so that you couldn't, a disgruntled in-law couldn't bring in a wife or a husband under the statute and accuse them of causing death, of giving their loved one too much medication, because intent is always a question of fact. And in this case...
Whoa, butter? That seems like a lot going on there. I mean, I like butter on things like potatoes. You're putting butter on top of the Pop-Tart like enough to melt it after I dropped my phone. I can't even. Oh my God.
The legislature changed the wording of the statute, took out the word licensed healthcare professional, and referred to the administration of procedures. It doesn't say administration of procedures by doctors. It doesn't say the administration of medical procedures. It doesn't say the administration of medically accepted procedures. It doesn't say anything. And therefore, this statute is applicable to this case, and the jury can certainly conclude that even though the procedure utilized hastened death in this case, which is undoubtable, the intent was to relieve suffering.
I'm gonna try it. I'm gonna try that. Anybody else in the chat here? Butter on top of a Pop-Tart? Is that a thing? Am I missing out? Damn. Not yet. I actually have done nothing. This is just me awake. I've just woken up. I did a lot of RSO last night before I fell asleep. Like they recommend doing like a rice-sized amount, and I did like mini rice-sized amounts, and I slept really well. My back still hurts, but
not only that, but Dr. Kassem indicated that the only way you would relieve suffering in this man, because to him, under medical guidelines or under any medical...
What? You gotta have the butter on the pancakes. What are we doing here? What the hell's going on? Butter on the Pop-Tart. Butter on a pancake? You gotta have a little butter. You gotta smear the butter on a warm pancake. It melts so instantly and so freely, and it's all over the place. Then you get a little bit of that syrup. It's the butter, the syrup mixture is actually what's making it. I don't like a dry pancake now.
Procedure known, you could never do it. The only way you could ever relieve his suffering in this case was for Thomas Hyde to peaceably pass away. Just like when a doctor cuts off a leg. He doesn't intend...
I'm kind of keep pausing. Butter on the sweet stuff's freaking me out. Wow. No butter on pancakes. No sex in the champagne room. No butter on pancakes. Oh, my head's doing a lot better. Yeah, hopefully this week. I never even put the thing back up. It's still over here. Yeah, my head's doing a lot better. I had a headache all day Sunday though, which is silly. It didn't really hurt. It didn't go away. So, yeah, somebody put some spray butter on a Pop-Tart. Wow, I'm learning some stuff. I've got to step outside of my box first of all.
To cut off the leg. He intends, Your Honor, to prevent the cancer from spreading. That's a question of fact for the jury. Intent is always a question of fact, and Mr. Kenny is now asking you to rewrite the statute back to the way it was before the legislature changed it. And I might add also, although I've often said that I didn't think there were many minds in the legislature that were of the highest order, I think somebody in that legislature, when they rewrote this, because not everybody in the this wasn't passed unanimously, sort of knew what they were doing to not, in effect, make Dr. Kevorkian's very existence to be a status crime. It would nevertheless have to be proved under a purpose of intent. And they knew what they were doing. And
this judge right now is like, dude, I'm trying to get some motherfucking chicken. I want to go to Chick-fil-A. Did Chick-fil-A exist in 1994? I bet it did. But judges love Chick-fil-A more than anything in the world. And I can concur. Is Chick-fil-A nationwide? Is that all over? Is that all over the country?
And if Mr. Kenny wants the legislature now to change it because he thinks Dr. Kevorkian is now proposing a wonderful theory under which no jury would convict him, he needs to take that up with the legislature. And not
oh, yeah. Chick-fil-A started May 23rd, 1946. So, yeah. Growing up, I don't think we had a Chick-fil-A at all, because where the Chick-fil-A is in our mall, which is a very shitty mall now, it used to be like an Orange Julius in the 90s. So
this court,
we didn't always
Mr. Feigl, let's get something straight here, okay? Now, it doesn't take much for me to grasp, the concept of a legal issue that's being argued. I can do without a lot of the gratuitous kind of remarks that are not directly related to the point that we're talking about, and that would make things much better, I think, for everyone.
I wasn't trying to be flippant, Your Honor. I honestly was I felt that was
He's mad. See? He's like, you're trying to be flippant in here? I'm ready to get some grub, dude.
Good legal argument.
Well, I'm sure you did. I just happen to think, that it was a bit more than what was necessary to make the argument, okay?
Sure.
Go ahead, please.
Your Honor, in looking at Section 3, we submit that the court has to look at it in the context of it sets out an affirmative legal defense.
I think this one's in Michigan. Well, let me double check that.
And what constitutes that legal defense is, to a great extent, a matter of law. Whether or not in each individual case the conduct rises to the level of that legal affirmative defense is for the jury.
Yeah, Michigan. Michigan versus Kevorkian.
To determine. But just like the court gives instructions on self-defense, the court tells the jury what constitutes under the law self-defense. Whether the facts of each individual case rise to that level is one for the fact finder to determine. But my position is that it is for the court to determine and interpret Section 3 to determine whether or not that affirmative legal defense is the dispensing or the administering with the intent to relieve pain or discomfort, period? Or does it have to be with the intent to relieve pain and discomfort but not cause death? Because those are two very different concepts.
Okay. Anything else on that? Okay.
Your Honor, I would like the opportunity, if we could, over the lunch hour, to see the legislative history. We do have some documents upstairs.
Well, there are two matters before the court now, and I think that that of involving the statute, of course, is a legal argument separate and apart from the motion, although to some degree related from the motion regarding the admission of the tape. Because there is to some degree a tie between the two in terms of understanding what the law says. But see, my thinking in general is that if the law says on its face, what it says, there's probably very little, I guess, room, to extrapolate, something from that, that is a matter of theory rather than what might be the natural intent of that based on the way it's worded. And I'm having some problems with that I will allow you some opportunity to address further if you can find more on that. But as it stands right now, I have to be concerned with making a legal decision based on whether or not evidence that is being proffered here should be allowed based on the nature of the charge and the theory of the defense, and whether or not is reasonably related and not barred by his prejudicial against his probative value. And I will allow you that opportunity to address that, and I would ask for the lawyers back, say about 12:35. I'll give you until 1:45 at least. This could be back here at 1:45, please, and then I'll let you make the arguments. Okay. All right. When we left this an hour and a half or so ago, there was an issue before the court regarding the statute, and tied to that issue whether or not a certain evidence should be admitted. Mr. Kennedy, you wanted some more time, I believe, to look at something. Are you prepared to talk about that now?
Yes, Your Honor. First of all, I would indicate I was unable to find any legislative history or background information that would hopefully clarify that issue that we're discussing. Dealing directly with the court's point about the film, I would reiterate our position that we believe that it is more prejudicial than probative at this point. Secondly, with regards to the tape itself, I think there's a foundation question about introducing it at this point without it being authenticated or knowing that it is admissible in regards to Rule 901. of the Michigan Rule of Evidence. That would be our position with regards to the admissibility of the tape, as the court had expressed its question. Could I go back and ask or make a comment regarding subsection number 3? Because as I had indicated to you before, I do believe that that is linked directly to this particular admissibility issue.
Go ahead. I'm here now to essentially make the record, on this. Obviously, as I said, or at least inferred earlier, we are in an area that has not been explored. The statute is new. I believe we all agree that this is the first trial to be instituted based on this statute. As such, there is little or no case law that has interpreted its meaning and implication, and we all know that we're often guided by such precedent, and certainly I rely on what other higher courts, have said about such thing in their wisdom and interpretation of the statute, but I don't have that, so I'm left to rely on general rules of statutory interpretation and/or other rules involving what is at issue in the trial in relation to the statute itself. So I'm open for comments in that context.
All right. Your Honor, with regards to subsection number 3, it's our position that that subsection raises a defense. It's not one of the elements that we have to prove in connection with this case, but that it's a defense. The elements of the offense are set out in subsection 1, A and B. Now, when you look at subsection 3 and you look at how it is set out and what defense is being offered, what exception is being offered to the statute, when you look at the entire wording, when it talks about prescribing, dispensing, or administering medications or procedures if the intent is to relieve pain or discomfort and not to cause death, even if the medication or procedure may hasten or increase the risk of death, it seems clear to me, Your Honor, that that particular section is talking about procedures or medications that are being prescribed or administered that may very well be risky. But as they say in the beginning of that particular section, and even at the end where they talk about hastening death or increasing death, that clearly they are talking about medications and procedures that do not have as a goal in and of themselves death.
That's the point I think that's being made, Mr. Kinney. Who determines whether or not that is the goal, that is the objective of the goal based on what is being done? Because the statute uses the word or procedures if the intent is to relieve pain or discomfort and not to cause death. Are you suggesting, that somehow the defense is required to show as a matter of law that the procedure that was used, that its intent was to relieve pain or discomfort, not to cause death, as an affirmative defense? Is that what you are saying?
Yes, that's my position, Your Honor, because as I indicated to you before, I think it's like self-defense. The parameters or what the law of self-defense is a question of law for the court to instruct on or to determine whether or not self-defense will be even allowed as a defense in a particular case. If the court hears evidence during the course of a trial that doesn't rise to the level of what self-defense is, then there is no instruction on that. And in this particular case, our position is that it falls to Your Honor to interpret this provision, albeit that there is no appellate court guidance, but to have you read those words and interpret it, and the way we are suggesting that you read subsection 3 is that it is directed at those medications and procedures that may be experimental, may be risky. It is designed to deal with pain or pain control, but because it is so risky, maybe it is something that would cause death, and that doctor is not intended to be the subject matter of an assisted suicide prosecution, as opposed to someone who administers a particular procedure intending to cause someone's death, and death obviously is going to stop the pain.
But if you take your analogy regarding self-defense, and use that as an example.
I think that's what it said, Karen. Isn't that what it said? Universal Life Church?
Example in analyzing what you are saying. In general, self-defense is a defense in certain circumstances, and it's my understanding of the law that it has to be essentially no evidence whatsoever that would present or prevent the use of self-defense as a defense by a defendant, let's say in a homicide of some kind. And if even remotely there is some possibility of the issue being there and it's raised as such, then it becomes a matter for the trial of fact, and a judge in that context cannot, as a matter of law, say that it was not self-defense unless it's so clear-cut in some kind of way that that's what it is. What you are arguing, at least if I understand it correctly, you are saying that this is analogous to self-defense. And even if we take that argument and if we say that there is some question, being raised here as to what that intent may be or may have been, how am I to be able to say categorically that that was not the intent, and that if there's something that the trial of fact has to decide? Moreover, when we look at this particular statute and the legislature, for whatever reason, put that particular paragraph in there and does not say, well, it has to be, an affirmative defense to be shown by a person in order to avoid what is required, by the law. It can also be reasonably read to say that, well, the intent is an issue that's there. In other words, the statute say, well, we will excuse this if that was the intent. But somebody has to determine what that intent is or may have been, and I don't know if I accept your argument that if there is some evidence on that in the record, that the judge can, as a matter of law, prevent that, and that there should be something for the trial of fact to consider. I mean, it's a weighted argument. It's similar to the trial of fact having to make a decision about anything in a criminal case as to what the person intended to do. I mean, if you got a homicide case and there's a question about the self-defense, the trial of fact looks at that to make a determination as to what was done, how, and what the person's state of mind may have been, and other factors, that weigh into that in determining whether or not that's self-defense.
I understand your position, Your Honor. I think you understand my position as well. I would also call the court's attention to the fact that with regards to Dr. Casson so far, his testimony on direct examination was to the effect that carbon monoxide was not, to his knowledge, anything prescribed for pain.
Well, then that becomes your argument, I guess, to the trial of fact, to say that, well, based on what the doctor said, certainly that intent could not have been that, but that's not suggesting, I hope, that I should take the doctor's testimony and say categorically that it should not be allowed because he said that therefore that precludes the defense from bringing it up.
No, I'm not saying that, but so far there's nothing in the record to indicate that carbon monoxide was in fact for the relief of pain. The record so far has indicated that it was.
Okay, well, let's look at it this way. Let's just take that that's what the doctor testified to, and and certainly when we get into talking about experts' testimony, the defense maybe can get a witness or a so-called expert to say that, well, hey, in some areas, of course we have to look at the Fry test and see if it's recognized and so forth, but they might say, well, this doctor, whoever he or she may be, this is the method, that they think that they could use this for. Then you explore the issue whether or not that is a legitimate, I guess, defense or a legitimate response, to that. And then it becomes the question of how the trier of fact weighs that, those factors, rather than whether or not, as a matter of law, what the doctors say precludes, making those kinds of arguments. Now, obviously, from my perspective, if I were a trier of fact, I would look at, how that's weighed against what was actually done, and say, well, if somebody used that method, is that meant to treat or to relieve suffering if you use that rather than using some other method that may have been more logical to use that may have relieved suffering in that context. But I'm not here to decide that. I'm not the trier of fact on this, so therefore I don't have to look at that. My concern here is that as a matter of law, does this statute prevent the defense from raising that as a defense, that because the wording is there, that is prevented, to be used, and then it becomes a question of how the evidence sets and how you argue that to the jury as to whether or not what is shown here fits into that part of the statute or doesn't fit into it. I cannot accept that I have to preclude the use of that, because, again, let's look at the very wording here. It says subsection 1 does not apply to prescribing, dispensing, or administering medication or, and I emphasize this part, procedures if the intent is to relieve pain or discomfort and not to cause death. Now, if the defense is saying, well, that the intent was to relieve pain or discomfort, not to cause death, then it becomes the prosecution's, burden, more or less, to say that, well, the procedure that was used here certainly does not fit that, because it was something that was used that could only lead to one conclusion. But you have to tell the jury that.
Your Honor, I think if you were to continue reading after you said not to cause death, where it says, even if the medication or procedure may hasten or increase the risk of death.
Well, that's just a modifier, right?
Right, but I think that modifies the relief-type medication that's being prescribed. It's being prescribed not envisioning that it's going to cause death in and of itself.
Well,
See what I mean?
I understand. I don't disagree with you, but what I'm saying to you is that in terms of what the trier of fact looks at in making that decision, that's the argument that you make. But I guess my response, and I can't put it any differently, is that I cannot say that as a matter of law.
This man wants to eat so fucking bad, bro. Oh, wait, no, I think they took lunch. My bad. I'm like, leave this poor judge alone.
That I have to assess this and make a decision that, well, this could not have been but one objective in mind, and therefore the defense is precluded from making that argument to the jury. I don't think that the statute is that clear. I mean, we can theorize and hypothesize about this. It's meaning, ad infinitum, but it's not going to resolve, I think, what is obviously the wording, of
oh my God, I know. Say no to globalism coming through with another $4.99, who's fucking amazing. All this food talk, time to pass the bowl and the plate. I think I'm about to pack a little something myself. And yeah, after I get off here, I'm going to have the nicest lunch today. It's going to be absolutely amazing.
I'm telling you like
Telling it like
baby.
it is, baby. Get a little dance in here.
This is gun country.
I love you, Say No to Globalism. Thank you very much.
Of the statute.
Into the snow.
This is interesting because we all know, from law school training on, that the legislature might write something, and then when it's tested, through the courts and so forth, and courts, look at it and interpret in different kind of way to give it different meanings, or at some point it may even go back to the legislature, for changes, as this one apparently did at some point. That very often, all of the possibilities are not looked at or or anticipate it, and you get to the very kind of thing, that we have here. Undoubtedly, it seems that if you read this, in fact, I'll be honest with you, when I looked at this last night, I was looking at this and I was trying to anticipate for my own use what I need to be prepared to answer to by way of law. And I read this statute, and I said, there's a defense that could be raised on this. I saw that. I mean, anyone I think who would look at that could say that, even with the arguments, to the contrary. It comes down to whether or not the jury want to accept that. If the legislator meant to put a stopgap in there or to try to soften the impact of the statute, by allowing certain things to be done, then very often, the wording of that doesn't accomplish what its objective, may be. And that's how I see this. So with that in mind, in terms of the statute itself, I cannot agree that as a matter of law, that particular defense cannot be raised, and that it becomes a question, for the trier of fact to make the decision as to whether or not what was done does or does not fit into the category that allows or disallows certain kinds of conduct. And to me, that's the classic and traditional decision, in terms of what the intent may have been. That's generally what we let juries do. So I will leave that one, right there. Now, the other aspect of this, of course, has to do with how this is tied to the tape that is there, and making that ruling. I think that it becomes somewhat rather obvious, I suppose, that there has to be weighed according to what the defense is. If the defense is that the intent was to relieve pain or discomfort, not to cause death, and if there is some evidence that may be there that may or may not support that, I then have to decide, based on rules of evidence under 401, 403, and any other rules of evidence as to whether or not that becomes relevant, or it is precluded under 403 because of its probative value and prejudicial effect being weighed. So I am prepared now, hopefully, to try to respond to that. I think I've heard all that need to be said on that, but just for the purpose of this record, and because we're in this somewhat gray area because of this statute, I'm willing to allow another or any other brief response to be made on that, and then we can proceed from there. Is there anything else you want to say, Mr. Kenny?
Well, Your Honor, I would just call the court's attention to the fact that based on the opening statement that was made by Mr. Feiger, clearly there are going to be other witnesses who are going to be called who will testify with regards to the pain and suffering that Mr. Hyde was enduring. Clearly, what appears in the tape, which the court has had the opportunity to hear, contains a number of very poignant moments in there that we would submit are certainly evoke very strong emotional response that we believe would be more prejudicial than probative when balanced upon against the fact that the defense will in fact have opportunity to call other witnesses to elicit that verbal testimony.
Brief response, please, Mr. Feiger.
Briefest response is that is exactly why I want to show it. This is by far the best evidence the jury could ever see on the defense that I am propagating in this court regarding, or I'm purporting in this court regarding the pain and suffering. And that is why Mr. Kenny does not want it in, but it's overwhelmingly relevant to that defense. And Your Honor, I'll sit down with that.
Okay. You may have a response if you wish.
No.
Okay. All right. Again, the issue here that's before the court is whether or not a tape, conversation, interview, however one want to call it, wherein the defendant, Dr. Kevorkian, Thomas Hyde, the person here, the subject of this case, and Mr. Hyde's, I don't know what best to call it, girlfriend, common law wife, whatever, live-in partner, however you want to put that, and another person whom I just remember the name Neil from the tape. I don't know the full name there, but I did look at the tape yesterday morning. I took the time to look at it completely, and I also reviewed certain aspects of that as I went along and looking at that. The tape shows the defendant, basically the defendant, Mr. Hyde and Ms. Fernandez, seated at I think was a table, and there were talk there about what Mr. Hyde, wanted to do and so forth. I will admit that there is a lot of somewhat extraneous, somewhat unnecessary, and maybe even other comments there that may be of questionable relevancy, but it'd be difficult, I think, to try to excise out, certain things if that were to be admitted. But in looking at that, I look at the rules of evidence here, and relevant evidence means evidence having any tendency to make the existence of any fact that is of consequence to the determination of the action more probable or less probable than it would be without the evidence. And I think the case law or at least commentary on that particular relevancy issue basically recognize that the definition of relevant evidence in Rule 401 sets forth a low threshold of relevancy, and that in order to be relevant, evidence need only have any tendency to make the existence of any fact and issue more or less probable. The rule encourages the admission of all arguably relevant evidence proffered in any case that if reasonable minds could differ as to the relevancy of a particular item of evidence, it should be considered relevant. Also, MR 401 is based on two concepts. The first is materiality. Although the actual words do not appear in MRE 401, the concept of materiality is embodied in the words, I quote, fact that is of consequence to the determination of the action. In other words, is the fact to be proven truly an issue. And the second concept is that of relevancy, which refers to the logical probative value of an item of evidence. And that question is, does the evidence have any ability to make the existence of a material fact more or less likely? Now, the other aspect, of course, of relevancy is the issue of whether or not under Rule 403, and I think I hear the prosecution mentioning that, and that is 403, and I quote that, although relevant evidence may be excluded if its probative value is substantially outweighed by the danger of unfair prejudice, confusion of the issues, or misleading the jury, or by considerations of undue delay, waste of time, or needless presentation of cumulative evidence. And of course, MR 403 allows the trial judge considerable discretion in excluding even relevant evidence if a judge finds the evidence is unfairly prejudicial, confusing, misleading, or redundant. And in general, evidence is unfairly prejudicial if it is likely to influence the jury on the basis of some factor other than its probative value. The advisory committee to the federal rule 403, which is basically the same as the Michigan rule, says, and I quote, in reaching a decision whether to exclude on grounds of unfair prejudice, consideration should be given to the probable effectiveness or lack of effectiveness of a limiting instruction, and also the availability or other means of proof may also be an appropriate factor. evidence may be excluded as confusing or misleading when the jury is not properly equipped to judge its probative value or probative worth, or when certain proof and the answering evidence that it provokes might unduly distract the jury from the main issue. I think that's basically Cleary's book, McCormick on Evidence, section 185 at page 546. Also, I think it's important to note that the use of the word substantially in MRE 403. So if evidence is to be barred, its probative value must be substantially outweighed by the dangers of unfair prejudice and so forth. Now, in weighing that and the relevancy on the 401 and the prejudicial factors on the 403, and again putting that in the context of what we just discussed about that part of the statute that talks about if the intent is to relieve pain or discomfort and not to cause death. Certainly, intent or state of mind becomes significant in that context. And the tape does, I believe, offer some insight information about what was or the intent of what was in mind at the time that this entire thing was being discussed, and that certainly goes to the state of mind of the defendant. Now, I fully realize in looking at that tape that it shows Mr. Hyde in a debilitating condition, that certainly it can evoke a certain sympathy and so forth. But I also would like to believe that the jury here would be able to look beyond that, although I don't pretend to be any authority on social psychological factors or factors that may in some way impress the jury one way or the other, because there's probably no real way of knowing that. But my looking at the tape and what I recall about the tape and when I weigh it against what its evidentiary value may be, I think it merits a cautionary instruction of some kind. But I will allow it to be seen. It's approximately 30 minutes long, if I remember correctly, and I will give some kind of a cautionary instruction, and of course to remind the jury that they ought to make a decision on the evidence in the case, not out of sympathy or any other factors like that. So. I'll leave it at that. If that is to be done now with the doctor, I guess we should take the time to set that up before we bring the jury back in. Okay.
Lawyers will note, please.
All right, this next clip is 48 minutes. Dr. Bader Kaysen, part 2. The jury sees the defendant's taped conversation with Thomas Hyde. Here we go. Yeah, long time trying to fight that, but that's something that's absolutely needs to be seen, because you see the actual state of mind of Hyde. You see how Dr. Kevorkian treated him. The one video that I was mentioning earlier from 99, the one that, he actually went on television with, I mean, he was very, very thoughtful in his approach with the entire thing with the assisted suicide. Again, made him sign multiple times, made sure he knew what was happening, and the individual knew what he was doing. So, all right, we're going to move on here, ladies and gentlemen. I love it, love it. Let's hit you with a little bit of I need to get a new stinger, but let's hit you with a Murder Church stinger, the old classic stream, baby. And the Nest Cam. Oh, it's a little high today. Boop, there it is. I hit the thing, the freaking cord on Murder Church and knocked it just a little bit sideways. But yeah, Yeah, I think I might have hit the even this camera. It seems to be a little bit off. Maybe not. I don't know. We're going into a little bit further down the Dr. Kevorkian road.
For the record that the 16 jurors are in the courtroom.
Yes, Your Honor.
Okay,
Yes.
thank you. Please proceed, Mr. Mayor.
Dr. Castle, I want to discuss with you a little the condition, the debilitating conditions known as ALS. So perhaps you should go up in the stand, and then I'll ask you to come down and sit at that seat. Doctor, I'd like you to assume for the purpose of this question that had Thomas Hyde not died on August 4th, his doctor had indicated to him and his family that within a day or two he would be admitted to the hospital for the purposes of inserting tubes in his abdomen to pour nutrients. Why is that necessary in ALS, if you know?
As we've mentioned briefly, the ability to swallow ultimately is lost. And while I'm not certain of the extent of Thomas Hyde's debilitation, I suspect that that would be the reason that a physician would say that to him. And so putting a feeding tube in directly through the abdominal wall would be an efficient way to put nutrients in a liquid form into the body.
Dr. Kassem, I've had marked as defendant's proposed Exhibit A video photographs of Thomas Hyde regarding his description of his symptomatology, taken approximately 30 days before he passed away. I'd like to ask you to view this with the court and the jury right now, and then I'll have some questions to ask you regarding that. And, Your Honor, pursuant to the court's previous ruling, I now move for admission
Turn the sound
of
off and the
defendant's proposed Exhibit A.
Mr. Ken, is that was already a matter of record in the other?
No other objections, Your Honor.
Thank you.
Thank you. Thank you. Dr. Kassem, if you could sit down, please. Stand down. Would you please play the video tape? I think we're on now.
This is July 1st, 1993, and we're in Novi, Michigan at the home of Thomas Hyde and his wife Heidi.
Yeah, warning before this is probably going to be some triggering stuff. I know the video from the 1999, the video that he recorded before he ended up sending that to, I don't remember if it was 48 hours or 60 minutes, he sent it to a television station. He was actually interviewed, and that's what he ended up being arrested for, and that trial ended up sending him to prison. But this one, I'm sure it's going to be similar in regards to this individual. Well, the one from 99 with Lou Gehrig's disease, it was way further gone, I believe. I haven't seen this yet, so I guess we'll see. But I know that the individual from 1999 was really worried about choking to death. That was his biggest fear. So, again, just trigger warning on anything like this. And, just be respectful for any kind of differing opinions in the chat. Love you guys.
8:22 in the evening. I'm responding to a letter.
I'll hit this real quick before we get into this. Lakota coming through with the $4.99. Lakota, love you. Thank you so much. I missed everyone here at church. Hope you all had a great Thanksgiving. Thank you, Pastor Steve, passing the plate. Let's go. Thank you very much, Lakota. I did have a good Thanksgiving, and I hope you had a good one as well. We pretty much just ate a bunch of food and chilled out. Now we're ready for freaking Christmas. I'm not ready at all. I need to do lots of freaking shopping, actually. Give me the loot. You know what? And this is a perfect plug in the Amazon field. If you want to go to Amazon, use the link there. I'm about to put it in the chat. That really helps us out here at Publicly Buzzed as you maybe do your Christmas shopping. So, but yeah, thank you all for being here. Appreciate the hell out of it. And again, Lakota, love you. All right, guys. Let's go. Austin coming through here as well. Woo! Thank you, Austin. All right, guys. And I'm actually going to go in the dark for 2 seconds. I need to blow my nose.
And I followed up with a telephone call, letter signed by Thomas, and a call in which I discussed things with his wife, Heidi. And we're here for the first consultation to discuss the situation briefly. I also will have Tom sign a request. I wanted him to do that on video. first of all, Tom Hyde has a disease which makes it difficult for him to speak. Is that right?
Correct.
All right.
Speech is almost unintelligible.
Right. Well, then you tell us what the diagnosis is.
Tom has been diagnosed, was diagnosed on August 6, 1992 with amyotrophic lateral sclerosis, ALS.
And what was the date again?
August 6, 1992.
In other words, almost 11 months ago. About 11 months ago.
Yeah,
Not quite a year.
Not quite a year.
And that's when he was first diagnosed.
That's when he was first diagnosed. He began being tested late May.
Where?
And they came through the Mind Clinic in Farmington Hills.
I see.
At Botsford Hospital was where he had his nerve and muscle biopsies done. He had his MRIs done through the Mind Clinic. Dr. Rossman was his doctor there. And Dr. Rossman was also the doctor that did diagnose him.
Now, how long before he was diagnosed did he have symptoms? When did they start?
Tom, when I've heard him talk to his doctors, they've asked all these questions, he says he can remember maybe February. Where he would get cold and his muscles were really affected by the cold air.
As he first noticed something wrong with his muscles then?
Yeah.
The cold effect. Never happened before that?
Or the fasciculations. I could see fasciculations when he would come home. And it was almost funny at first. He would say, "Look at my muscles," and they would be moving, rippling.
Rippling.
Yeah, fasciculating.
Where, mainly on the chest?
It really was on the right side,
Right.
which is his mostly affected side, and it was right up in here. And then it would stop, and then a couple weeks later we'd be watching TV or something. And said, "Look at this! It's doing it again," and then it never stopped. And then it began to be on the left side now, and his legs would shake uncontrollably. And when I say they tremor like this, I can sit on his leg and I move up and down with it, and I am I'm far from frail.
Yeah.
And I can try to stop his leg, and I'd be moving like that. with
Even
the
having
leg.
pressure like that. When
Yes.
And now that started in February, roughly.
Yeah. Fasciculating. The stiffness.
I see.
The cold really affected, would make his muscle very stiff.
And this was especially hard for him because we've seen pictures of him. He had a very strong physique, and he was a rock climber, a cliff climber,
A tree climber.
a pole vaulter.
Yeah.
Yeah.
And it was I could see it. It was not only something that he was experiencing the stiffness, I could see the stiffness. I used to think he was a clod because he couldn't walk across the room with a cup of coffee. And it'd stain my carpet. But I had no idea what I was talking about.
Right.
I feel so shameful now that I had said all those things.
That's the story of everybody's life.
Hindsight is a gift.
Well, okay then, and then he entered the clinic at Ford Hospital. Is that correct?
He entered the clinic at Ford Hospital in January.
Of '93.
Yes. We were well diagnosed and far into the disease before he started with the ALS of Michigan, which is at Hannaford Hospital.
And he was accepted for this special drug treatment, wasn't he?
Well, they were going to, but actually the manufacturer of the drug was going to be the people that were going to select the candidates. But the doctors and the staff felt that Tom had a strong, with him being so young with this disease, felt that his candidacy would be likely because of his age and being strictly so young.
Now, his birthday is October, isn't it?
October 1st.
October 1st, and he had the onset of symptoms in February when he was 29.
Yes.
So he had the disease.
And he was diagnosed when he was 29.
Diagnosed when he was 29 years old, and now he's 30, and the disease has progressed rapidly in less than a year.
Oh, yes, quite rapidly.
It'll be a year in August.
It's progressed rapidly in the last 3 weeks.
It'll be a year next month.
Yeah. It seems the more we get it, the farther the longer he has the disease, the faster the progression is.
I see.
Before it was slurring of speech. It was another sign that made us go to a doctor.
When did that start, the slurring?
The slurring was in May.
Of last year?
I'll tell you, we both say May because I was pregnant. I was in the hospital having a baby, and he stopped to get me a dinner and had a drink because they knew me. They bought him a drink, he had the baby drink. And he came to the hospital, and I accused him of being so drunk in front of my family. I said, "You came here drunk, how dare you, in front of my family?" And he said, "I had one cocktail." I said, "No, you didn't. You are lying. Listen to your speech. You can't even talk."
And you feel bad about that now, don't you?
Oh, my sisters were like, "Oh, how dare he? You're in this hospital bearing a child, and he goes out,
Yeah.
when he should be here with you, and he's out drinking." But you
Talk
couldn't.
about unfairly condemned.
You couldn't convince anyone that you wouldn't even have been, if you didn't know he wasn't sick, you would have called him a liar too. His speech would get slurred right away. I would say that probably in a matter of maybe 3 months after he was diagnosed, which would be September, October, November of '92, he was getting very hard to understand.
Yeah. Now, did he get the special drug treatment?
No.
Why not?
Well, he wouldn't be able to be part of the study now because he has respiratory problems. The disease, which we were explained at his last visit at Henry Ford, he stayed for 2 days because he had an episode of respiratory problem here. He couldn't breathe because the phlegm was in his throat.
I notice he has some trouble swallowing right now.
She likes to eat dinner.
Can he eat solid food, or does he stay on liquid food?
I try to keep it soft.
Yeah, okay.
I try very hard to keep it, but it doesn't matter. Like Tom will tell you, he'll choke on his saliva.
Yeah.
So it doesn't matter. He'll choke on water.
Yeah, that's known, yes, that's right.
But,
okay, so he didn't get the special treatment because of respiratory weakness.
yes, he would be then not a candidate because they don't know the side effects.
Yeah.
So they were definitely ruling out people that where the ALS was beginning to affect their lungs, which is the onset of the end.
Yeah.
Which is when they recommended hospice.
Okay.
Which to me is a sign that there's nothing else the hospital or the doctors can do for you.
Does Tom want to go into a hospice?
He doesn't want to go to a hospice.
Tom, do you want to go into a hospice? Why not? What's your main reason? Wants to maintain his dignity, and he feels that being dependent in a hospice is not dignified. Is that correct, Tom?
Which is totally dependent. I mean, I need to lift him. I need to.
We're gonna have to show him walking a little bit in a while. Does he have control? You have control of your bowel and bladder?
It's getting worse. He has is. I mean, when there's been some.
Okay.
And that also that has been progressive. You can see that progressing too, where you just can't get there soon enough or something.
All right, now, Tom, do you have any pain anywhere?
Muscle cramps. Intense muscle cramps.
Where? All over?
He gets them a lot when he yawns.
I see.
Too. But he gets them everywhere.
Biceps, triceps, forearms, hands, throat, tongue. Can you stick your tongue out? As far as you can.
Can you see his fasciculating?
Yeah, see the fasciculating. Can you focus in on that? Focus close in on his tongue. Stick it out. Show it fasciculating. That's quivering.
Yes.
Quivering. Okay, Tom.
If we removed his shirt, you could also see that too.
Yeah, now, can you move your arms at all, Tom? I'm sorry to put you to all this strenuous effort. As far as you can. Okay. Don't go too far. Don't strain yourself. Can you stretch your fingers out? Okay. Can you make a fist now? Okay. The right arm is definitely weaker, isn't it?
Yes.
Yeah. Okay.
Well, that was
Can you move your arms like this at all? Yeah. The deltoids. Okay, don't strain too much, Doc. Don't strain.
Conserve your energy.
Yes,
So you know
yes.
you get a
Now he's
cramp.
getting cramps, right? Okay, we're not going to go any further with the physical thing now. I just want to see you walk a little bit. Try to walk a little bit for the record. That's all. Well, Tom, what is it you wish? Tell me your wish in plain English. Take your time. Take your time. I understand he first said, I want to end this. Right? Okay. I'm going to have Heidi read something to you. I want you to understand it. And this is your request. And first of all, has anyone that you know of, Heidi, anybody in this room, any relative of yours, ever tried to talk you into doing this? Is it your choice entirely? Absolutely?
His idea.
Yours alone?
He asked me when he was in Florida, when he was there visiting, and he wanted me to get your address.
Okay.
I obtained that, and I sent it to him, and he wrote you and signed the letter himself. I knew that was totally on his own.
And he doesn't want hospice?
He does not want to prolong what he does. Tom and I communicate a lot better on mindset. We read each other with our eyes.
I understand.
And Tom is suffering so.
I understand.
And he wants to be free and to be free of this body. This is only a body.
Right.
His soul will be free.
Right.
And this is, he needs to free his soul.
He's a free spirit trapped in this body.
Yeah.
It's it's going to be your choice, Tom. Understand that. No one's ever going to try to block you or talk you out of anything you don't want to. Don't worry about that. Okay?
His
I just
crying,
want you to relax.
his crying and laughing are uncontrollable.
That's good.
It's part of the disease.
I want him to relax as much as possible. I don't want him to have any fear.
What do you want me to say? What do you want me to do?
You want to write something down? Okay. I'll get the piece of paper.
What are you going to do?
I feel like. You like the pen? Why don't we leave it?
Well, no, sometimes I make him write for me.
You like that pen?
I can't.
Okay, it's yours.
It's
He writes it, he can write this way, so it is very legible. It's a good way to communicate.
do you want a thing?
Yeah. Here. Okay.
I feel like the
The
main.
main. You're like the main character. Ian, is it more coming?
Don't put words in his mouth, though, I'll tell you. I've got my head snapped off for that before.
I know.
Right, honey?
I'm going to stop right here and see what he writes.
In the book.
I feel like the main character in the book.
Oh. Johnny got his gun.
Oh, wait a minute. Carl told me about that. We'll discuss it later.
Finish writing it, though. I would like you to have this.
I know what he's writing. Carl told me about the whole thing. I never read the book. I never saw it. It's an interesting thing. Wow. Huh? Carl, friend of mine. Oh, yeah.
He's been stating this since he described this feeling to some friends of ours that we hadn't received occasionally, and we talked about it, and all four of us
All right,
cried
no
about it
problem.
one night because of the story is so heart-wrenching.
Nobody but Tom would really know how that character felt.
That's right.
We can't know.
No, and I had never read the book, but I cried when he was telling my friend. He was telling on the typewriter because he can't speak, but must read.
Yeah. I know about the book. A friend told me in detail about the book. He told me in detail. We'll discuss it later. He brought, I feel like the main character in the book, Johnny Got His Gun. Must read. Focus in on this one.
Focus and then make it
That's
legible.
pretty good printing, by the way. It isn't bad.
And I'll tell you, the pen is good.
George, we got other ones at home. You got it? Okay. Now, Heidi, you have to read this to him.
Okay.
And let me write his name here. Thomas. What was the initial name? W. Hyde.
Junior.
Junior. Let's put the whole name.
Junior.
Okay. Now, you have to read this to him. We blotted this out because we can't obtain the drugs right now. This is about the drugs. And this is what you've got to read. This is the request that, let's see if this is what Tom wants. Okay, you read it to him slowly so he understands everything.
He understands everything.
Okay.
Fast or slow, but I'll read it slow. I, Thomas W. Hyde, Jr., the undersigned, hereby request, of my own free will and without any reservations, or extrinsic persuasion or duress, that my life of intolerable and interminable pain and or suffering be ended in the most humane, rapid, and painless manner with the help of a competent medical professional. It is my understanding that I will end my life by breathing through a routine facial mask or plastic tent, a lethal mixture of carbon monoxide and nitrogen gas. All details of procedures have been explained to me by the undersigned medical professional, and I am fully aware of the implications and the consequences of my voluntary carrying them out. You understand?
Do you understand that, Tom? We're going to go over more of the details off camera. We're going to go over the details.
He understands that.
Okay. If he has to, he can sign one more thing. I hate to put him through all his signature.
It feels like...
It's your pen, so be careful. It's your pen.
Yeah, don't wear it out.
Right here, Tom.
They sell more.
Yeah. Not this on
Go ahead.
And then your witness and ID, okay?
Yes. This is like, in the rock star who likes autograph.
Well, he writes so well now. He must have had good penmanship earlier.
Yeah, he did, honestly, for a man. And I have excellent penmanship. My printing is artistic to the point of almost like a typewriter. And Tom has always mentioned, said that, but his
Yeah,
printing is
even this
good.
isn't bad. In his debilitating state, he writes fairly well.
Mm-hmm.
Okay. And then I'll fill in the rest. I'll fill in the site. Okay. One other question I've got to ask. Tom, what is your religion? Take your time. Agnostic. In other words, you don't adhere to any organized religious doctrine or sect. None. And do you want any kind of a religious counseling at all? No. None at all? No. Okay. None whatsoever. Okay. Is there anything else that you want to add to this, or have Heidi tell us? Or Heidi, is there anything you want to add before we conclude this discussion?
I watched him suffer too long. I'm sorry. That's all I want to say. It's just too much for us. Every day it gets worse.
We're here to help. Don't worry, Tom. You're not alone. You're not alone.
No.
You're not alone.
We love you, baby.
Neil, is there anything you wish to add?
You want to cover your fee on
There's
the camera?
Yeah. Okay. Well, Sam, there is no fee. You know that. There's no charge for this. So don't worry about money.
And also, we'd like to emphasize that at any time, up until the time that you pull that clip off the hose, you have the right to stop. Our feelings won't be hurt. We'll walk away. We'll be just happy if you don't do it, and if you do it. You have that right. You have that control. And you're going to do it.
That's right.
And don't worry about us. If you decide that you don't want to go through with it, you can stop it at any time.
That's right.
Walk away from it and be just as happy.
We're absolutely neutral. We can't hurt our feelings either way. If you want to stop, 1 minute before you reach for the thing, stop. It doesn't hurt any. We can come back another day. Anything you want. You got to understand, Tom, you are in control. Okay?
This is the only thing that he has control over.
That's right. He's got absolute control on this. Nobody is going to deny or contradict or argue. Nobody. okay? Not even a so-called law.
He wants control, and this is the only control that he will have. To control his destiny, you know.
I want you to relax as much as possible. The time's left. Try to enjoy yourself, because you're not going to, you're going to get what you want. But relax and enjoy yourself. And we'll go over a lot of details off camera, okay?
Okay.
All right. As it is now, what time is it?
8:50.
All right. This first session then is completed at 8:50 p.m. on July 1st, 1993.
It ends there. Okay. Thank you.
May I proceed, Your Honor?
Yes, please do.
Dr. Chaffin, I'd like you to ask you a few questions, follow after that tape. I want you to assume that Mr. Hyde died on August 4th, about approximately 34 days afterwards, and his condition is described 34 days afterwards as far more severe, to the point of, like I indicated earlier, tubes being ready to be put into him. How could the disease progress that rapidly, that fast?
The disease is described in all cases as being progressive. In some cases, as I've mentioned, it appears to stabilize or stop and not get worse for a period of time, which may be even years. But in others, it appears to progress very rapidly. It happens by a continuing worsening of the central nervous system, specifically the spinal cord. So the degenerative changes progress. More cells within the spinal cord continue to die, meaning that there is less control with time over the voluntary muscles as well as the other functions of the body, including some of the cranial nerves, such as that which controls the tongue.
The tape starts with a description of the onset of his symptomatology, including rippling muscles on one side, then another, then uncontrollable tremors over the whole body. Tell us something about how that is representative of the initial stages, at least in what you heard described, and I've tried to repeat.
Rippling muscles, or fasciculations, and the word was used on the tape, are evidence of a partial control by the spinal cord and its nerves of muscle groups, voluntary muscle groups. As the absolute control of muscle groups is lost, there are misfirings, if you will, by the nerves. There are involuntary motions made that are not always under the control of the person, because that message center in the brain is unable to send a complete and controlling message. So at first there are fasciculations or rippling muscle activities. Eventually there is no activity in many muscle groups.
The way he would express himself or attempt to speak is to lift his neck up, almost extend it, and appear to do some type of physical action that would help words come out. Could you tell us or help us understand what was going on there physiologically?
The way I interpret that is his ability to do two things. One is to control his secretions. He, like all of us right now, produce saliva. In the process of moving one's mouth and tongue, a greater amount of saliva is produced. He is aware of that, but is unable to control that easily. And so a way to do it is to use gravity, which is to, I believe, extend the neck and increase or elevate the mouth so that saliva does not run out of his mouth. The other possibility is that he's also able to have his tongue relax into a position where it's more useful, if you will. He can emit the most intelligible sound he's able to by allowing his tongue to be in a more comfortable position.
He also appears to have a mask-like or expressionless face, similar to what I've observed in Parkinsonism and that related syndrome. Did you see that symptomatology?
I certainly did. He's unable to control his...
Yeah, I got that link, Mandy. I got this pulled up here. Also, Shannon, thank you very much. Coming through with $5. Going to light a candle for Tom Hyde and Heidi and post on Twitter. Hope you all will join me. Thank you very much for that, Shannon. Really appreciate it. Yeah, that video was tough. That was very, very rough to watch. And also understand if anybody had to step away on that one. I had to step away there for a moment. That was extreme. Oh, Ashley here. He's sent a Venmo as well. Or at least I hope so. Otherwise, I sent it to someone else. Let me look at that real quick, Ashley, and I'll hit you with this phone. But yeah, Mandy sent me a story here. Yeah, I'm going to pull it over here. Let me just make sure I get this correct. ALS might be one of the worst things I've seen. I mean, there's a lot of horrible diseases out there, but this one is terrible because it hits you so fast from a normal life that you're living and just takes it so rapidly. And like the scariest part, it seems, is that your mind is still normal, but your body just can't function. But yeah, Mandy sent this. This was her mother-in-law. But yeah, let me bring the actual article over here. A second, let me make sure I get this right. Let me change cameras for 1 second. Boo, 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 boo. Man, but yeah, that was intense. That was a lot, man. That might be the hardest thing I've shown yet. I had to take a little bit of a breaky poo there. And yeah, Ashley, don't let me I think I see that already, actually. Hold on. I do. $10 from Ashley. Thank you so much. Coming through. Love you so much. Appreciate it. But yeah, this was sent by Mandy. Go back one here. The ALS Association just announced it has received more than 70 million in donations this month, compared to just 2 million for the same period last year. Man, yeah, that's why some more awareness needs to be made by this horrible disease. It's all because of the summer's biggest viral sensation, the Ice Bucket Challenge. Jessica for Justice was just mentioning that in the chat there. I remember that challenge. I never did participate in it. People are challenged by friends to either donate money for ALS research or dump ice water over their heads. Many people do both, but the local group of doctors decided to do more than just make a donation. The medical team at the Carrick Brain Centers in Irving is donating free treatment to a local woman suffering from ALS. What we're trying to do is prolong quality of life. If we can improve swallowing, if we can improve speech, those are significant improvements in the quality of life. Sherry Lewis, 64, started her ALS treatment on Monday. She was diagnosed with the deadly disease in February. She can no longer speak and has difficulty swallowing and chewing. I know there's nothing I can do. I can't help her in any way. Just watching her slowly deteriorate, says Sherry's husband, Tracy. It's really bad. The goal is for her treatment is to get her chewing, food, and swallowing again. I mean, that's the scariest part here, the terrorizing part, that your brain's still functioning and you're scared to death of actually your muscles aren't working well enough to swallow, so you're afraid of choking. I can't talk to her at dinner. She'll attempt to talk and choke her up. You know, so losing just the normal thing, you know, talking to your wife at dinner is gone here. On Friday, Sherry, her husband, and their 5 grandchildren came to the Carrick Brain Centers to watch her new doctors do the ALS Ice Bucket Challenge in front of them. The doctors are all privately contributing to ALS research, but they decided to offer Lewis free treatment. That's awesome. Again, that's really cool. As she watched, Sherry couldn't cheer for her family or tell her husband, "I love you," but the spark in her eyes told the whole story, a tale of pride and courage. You have a very short window to work within, so it's a challenge, but it's a labor of love for us. We want to do everything we possibly can for our patients. Freddie Yu, I'm butchering that one, said, most people live just 3.5 years after they're diagnosed with ALS. The disease slowly eats away at the ability to walk, use their arms, speak, swallow, and breathe. He's treated about 15 people in his career with ALS. It gets tough. I'm very faith-filled, so it helps to think that we can give a patient an additional day, an additional minute, an additional second of improvement if they're in their quality of life, then we're doing God's work. The Lewis family said they greatly appreciate the financial help. They are currently converting their house in North Richland Hills to be handicapped accessible so Sherry's husband can work from home more often. As millions of dollars in donations pour into ALS research every week, they said he's happy the viral sensation is making a real impact in social awareness about the disease. We need to get this thing trending again and get ALS in the conversation more. I mean, it's a really scary one, man. We've made such amazing strides with cancer, everything from different therapeutic options, different surgical options that we didn't have 10 years ago. We want to have that same type of enthusiasm and zeal as for ALS. 100%. It's such a devastating disease to have, and for the lifespan for patients is so short, we need those dollars and as many dollars as possible to give us options to prolong life and help one to get a cure. Yeah, thanks for sending that, Mandy, man, and that's heavy. Like, that's, oh, man. Yeah, this is, it's a lot, man. Like, it's scary. It's you know, I really do like Dr. Kevorkian, honestly. You know, going into this, I didn't know a lot about this. You just hear about Dr. Death, and it's kind of almost got like a sinister vibe to it. But no, this individual, this man was a saint. Are you kidding me? That's the second video I've now seen of him dealing with a patient with the same disease, and dealing with them with actual love and compassion. And it's a lot, man. It's so, and again, Mandy, to see that firsthand, like, I can't even imagine that one. You know, the closest thing to, you know, I grew up with my grandparents, and my grandpa died of lung cancer, and I've seen that happen. And, you know, it slowly took him away, but it's heavy, man.
While there was a lot of emotion, let me say, and valid or appropriate change of expression, it was the involuntary expressions of emotion.
Oh, shit. Oh, hold on. She said there's a video. Let me watch the video, too. So, I want to watch it myself. Okay, yeah. Up top. Hold on. I got you, Mandy. Get through this ad here real quick. Been getting killed with the ads is what I've been getting. I got you now. There we go, Shannon. Thank you again. $4.99. Lighting another candle. Hold on.
It's received more than $70 million in donations this month, compared to just $2 million for the same time period last year.
And it is all because of this summer's biggest viral sensation. You see it behind me, the Ice Bucket Challenge. Most people donate money, but NBC5's Jeff Smith found a local group of doctors who donated something even more special to a North Texas woman fighting the disease.
Everyone seems to be doing the ALS Ice Bucket Challenge, from celebrities to president. Most people make a small donation, but those with ALS fight to survive. For 64-year-old Sherry Lewis.
Oh.
Chase Cooley here with Clay Cooley Nissan in Irving. I want to invite you into our showroom, conveniently located at 183 Carl Road in Irving, to check out the new redesigned Nissan lineup. Whether you're looking
like,
for
you haven't had enough of this ad. They know that I tried to get away from it, but having muted.
You always get peace of mind with our Clay Cooley family guarantee, with a 3-day return policy and a 7-day vehicle exchange. And all of our used cars are Motor Trend certified and come with a 12-month, 15,000-mile limited warranty for free. Shop me first, shop me last. Either way, come see Clay.
The ALS Association announced it's received more than $70 million in donations this month, compared to just $2 million for the same time period last year.
And it is all because of this summer's biggest viral sensation. You see it behind me, the Ice Bucket Challenge. Most people donate money, but NBC5's Jeff Smith found a local group of doctors who donated something even more special to a North Texas woman fighting the disease.
Everyone seems to be doing the ALS Ice Bucket Challenge, from celebrities to president. Most people make a small donation, but those with ALS fight to survive. For 64-year-old Sherry Lewis.
Damn. Yeah, it's not playing the video, Andy. Unfortunately. That's stupid. That is stupid.
Hey guys, Sierra
and it
here
just
with
goes
Clay
back
Cooley
to an ad.
We know you have options when buying a car, and that's why we have the Clay Cooley Family Guarantee on every...
That's dumb. Give this shout out too. This is through Discord actually. Became a Patreon. Laura M. Thank you very much. I'm going to give you a shout out right here as well. Appreciate it. Now, this week on Patreon, I'm about to start putting some content on. So that's going to be happening. I don't know what's going to be happening. I'm going to be doing some different stuff. It's going to be something that is exclusive to Patreon though. So, but yeah, Laura M. Thank you very much. Go get some more water. Oh shit. No sound. Oh damn, it was from the video. Hold on. I'm the worst with the switch. Hold on. My bad. I'll go back just slightly here.
Your photograph obviously is C, the later photo.
Sorry about that.
And Exhibit D, the writing that appears on the videotape. I feel like the main character in the back of in the book Johnny Got His Gun must read.
Okay, those are it.
Thank you. My first question is, Dr. Kassem, would you take a look at Defendants Exhibits B and C, showing Mr. Hyde in August of 1991 and then shortly before his death? There appears to be a major deterioration in terms of his muscle structure. He looks almost to be debilitated. Well, why would that result from this disease, if it did?
The earlier photograph obviously is C, the later photograph is B.
Right.
There is, as you point out, a remarkable difference in the muscle mass. It is a fairly characteristic picture of chronic illness, And in this case, it would be, I think, best explained as generally due to atrophy. It could come from two things. One is the lack of activity. So there is a general muscle wasting or loss of bulk from decreased physical activity or exercise. There is also, over time, a loss of nutrition through progressive deterioration of voluntary muscle, or loss of specifically the ability to swallow or eat easily. And so the loss of calories and protein through the ability to eat also contributes. So in general, I would say it's due to loss of exercise and loss of nutrition.
The picture dated July 27th, 1993 is taken only 7 days before you performed the autopsy. Is that consistent with the way you saw the deterioration in terms of his body at the point in time in which you performed the autopsy?
Yes, sir.
Thank you. I'm going to hand to you Defendant's Exhibit D, which is the writing which we observed Mr. Hyde execute on the tape. He appeared to, my first question is, he appeared to have difficulty even holding the pen in his hand, let alone making writing movements. Is that consistent with the disease, and if so, how?
I thought that there were several things that I noticed there, and that is that he appeared to move very stiffly and slowly. He also did not have strong grasp, and those things I associate with, again, a decrease in the nervous system's ability to control muscular movement. So it's a deterioration effect, again, of the spinal cord's effect on the muscular system. Also, there's some evidence here that he had some tremor. In these large letters, there is a waviness to many of the characters.
And the tremor is the result of what?
Again, the tremor is a result of loss of fine motor control of muscles, voluntary muscle.
You indicated in response to questions by Mr. Kenny that often the cause of death beyond simply choking or stopping breathing would be the result of an opportunistic infection, such as developing into a pneumonia. How does that lead into the death process in these patients?
Pneumonia develops because of the inability to move the lungs with normal vigor, even at rest, let alone the loss of exercise, the inability to raise secretions out of the throat and to either swallow them or expectorate them. And ultimately, one is overtaken by the bacteria in one's biological environment. So the bacteria that are in the nose and mouth are then easily and without much without any barrier, really, a barrier allowed to simply go into the lungs down the airways. Pneumonia, in that case, is an infection of the lungs or an invasion of the lung tissue by those bacteria. The bacteria proliferate. The reaction of the body is to increase the local inflammatory process, increase the cells as well as the retention of fluid. And from there, from the lungs, infection spreads throughout the body. So it goes out through the blood vessels and affects all the organs of the body. Death results, as I mentioned earlier, most commonly from infections through pneumonia.
You indicated that there's an inability to expectorate. You mean cough, literally, to expel the phlegm or the accumulation of fluid. Is that correct?
Correct.
So would I be right in characterizing the final processes in terms of that form of death, where literally the patient is drowning in his own phlegm within the lungs or whatever fluid is accumulating in there without any ability to even cough?
That's correct.
he finally describes cramps, which we observe on the tape, which appear to be quite painful in his biceps, forearms, hands, throat, and tongue. Is there pain? What's the pain mechanism associated with these cramps?
When individual muscles or small muscle groups lose their control, they will contract. Muscles only do one thing: they contract, they shorten. When muscles shorten without control, they sometimes go into spasm. They go into a sustained shortening, and that is frequently described by the word cramp. With a sustained cramp or shortening, there is such exhaustion sometimes of the muscle that pain ensues. It would be something like excessive exercise that perhaps some of us have done at one time or another, where the sustained contraction of a muscle can lead to actual pain in the muscle. It fatigues to the point of becoming painful. That happens in individual muscles. In people who have the ability still to feel, the sensory portion of their nervous system is not destroyed, and so they are able to feel pain.
It seems in that respect you wouldn't want to give these patients either muscle relaxants or opiates or barbiturates, because they either relax the respiratory system even worse, compromise the respiratory system even worse, or have an effect on the muscles themselves to the extent that it might hasten death.
I can't speak to that too well, but in general I would say that it is a concern that any therapist would have, and as far as I know, only small doses are given to try to control the involuntary muscle movements.
Thank you very much. I have no further questions, Dr. Casson.
We direct Mr. Kenny.
Yes. Dr. Casson, with regards to these muscle crampings that you described and Mr. Feiger asked you about, what type of medication is prescribed to assist in that particular problem?
There are several medications that are available that are generally considered helpful in that regard. Benzodiazepines have been around a long time and are a group of minor tranquilizers that are frequently used.
Excuse me, Doctor, maybe a quick report about what you just said. I saw her eye blink there, so tell her what you just said.
I use the term benzodiazepines.
Can you give us an example for us laymen, what type of drug name we might be more familiar with that falls into that group?
A common one used is Valium.
And to your knowledge, is that Valium or drugs like that normally or frequently successful in addressing that concern, that cramping?
Well, they're used in many people who have cramping for whatever reason, and apparently they are of value. Whether they would be of value or to what extent they would be of value in ALS, I'm not sure.
You've described for us the fact that as this disease progresses, breathing becomes more difficult.
Yes.
Can you tell us, Dr. Casson, for someone in the stages of the disease as Mr. Hyde was, as depicted in that video, is there anything that you're aware of that is done to assist people with breathing problems?
Eventually one must, if one wishes, take over the respiratory efforts, the breathing efforts of the person. When the person cannot use the muscles of respiration on the chest wall and on the diaphragm, that must be substituted if you're going to treat it at all. This means that a tracheostomy would be necessary, and mechanical ventilation would have to be used to aerate the lungs, to move air in and out of the lungs.
Now, are we talking about then confining someone to a bed then for the rest of their life, or what?
The person may not necessarily be confined to bed, but would be confined. It would be confined. A person with ALS would have to be confined at least to a wheelchair. If they were so debilitated they wouldn't be able to breathe and had to be on ventilator assistance.
And when you talk about a ventilator, what type of object are you talking about, sir?
I'm talking about a breathing machine which has a bellows in it and actually forces air into the lungs and takes air out of the lungs.
Thank you, Dr. Casson. I don't have anything further at this time.
Yeah, one last question, a follow-up to the benzodiazepine question. I want you to assume that his doctors at the MDA, Muscular Dystrophy Association, had been prescribing Valium once or twice a day since October of 1992. In light of his complaints in July of 1993 about the continuation of pain, does that indicate to you that the Valium is ineffective in dealing with that?
Assuming that he was taking it every day in the prescribed amount, one would reasonably assume that it's not having the desired effect.
Thank you.
Are there any alternatives to that then, if the Valium was not working?
I'm not aware of any.
Thank you.
Mr. Hyde, any other questions?
Thank you.
Thank you. May the doctor be excused?
Yes.
Yes, may I ask the doctor may be excused. I'm sorry, Your Honor. I was just going to ask that the exhibits be passed around like
Yes, they may. They are and they may be published. Okay, doctor, thank you much. You may be excused. Okay.
Let's see how long the next one is here. 15 minutes. Let's get through another one here. Officer Anita Banks, Detroit police officer Anita Banks takes the stand. Yeah, today's been a little bit rough, a little bit hard. Appreciate everybody for hanging out this morning. Thank y'all so much. Just hit noon here on the East Coast. Wherever you are in the world, Publicly Buzzed, Steve, Dan, me, I, get my words straight in a minute. Really appreciate it. Yeah, let's go through another one here. This one's 15 minutes. I'll give y'all another little stinger before we get started. And if Mandy, if you're still listening, if you find that video, let me know. I want to watch that. Again, the story that I showed earlier, that was her mother-in-law. So, I mean, to deal with that personally like that is, I couldn't even imagine how difficult that is. Yeah.
Good afternoon. Would you please tell us your full name?
Anita Banks.
And what is your occupation, please?
Police officer, City of Detroit.
How long have you been with the Detroit Police Department?
8.5 years.
Officer Banks, let me ask you to think back to last summer, specifically Wednesday, August the 4th of 1993. Can you tell us, please?
Now you're thinking. That's why we're partners, brother. The man called Sting. Woo! Sting's a little woo too, guys.
Please, were you working that day as a Detroit police officer?
He does this. He does that. He's big as a wolf and quick as a cat. I think that was the lyrics. He's something. Oh, yeah. He's the man called Sting.
Yes, I was.
Could you tell
That's old beach surfer Sting, by the way, early 90s.
Please, what your assignment was that day?
Dude, Jessica, I mentioned that last week. I was like, why can't we see their whole body? There's something strange about it. I don't want to see below the waist while they're up there on the stand. There's something that feels unnatural about it.
I was a Belle Isle unit on Belle Isle.
Were you working in plain clothes or were you working in uniform?
Uniform patrol.
Did that mean that you rode around in a marked police car?
Fully marked, yes, sir.
Do you happen to remember what shift you were working?
Day shift.
Which meant that you started your work day at what time?
6:45 a.m. to 2:45 p.m.
I'm going to ask you, when you were working that day on patrol, were you working by yourself?
Yes, I was.
No other officer in the car with you?
No.
Can you tell the jury, please, during the course of your work that morning, did you ever see a Volkswagen van at all on Belle Isle?
Yes, I did.
Do you happen to recall when that was?
It was approximately between 8 a.m. and 8:30 p.m. 8:30 a.m.
Let me show you what has been marked as People's Exhibit number 1, color photograph. Can you look at that? Tell us whether or not you recognize what's shown in that photo.
This is the van I saw.
Officer Banks, when you saw this van between 8 and 8:30 in the morning, do you recall where it was?
It was parked near the zoo on Belle Isle, on Central Avenue.
Can you tell us, please, what action, if any, did you take as a police officer in connection with seeing that particular Volkswagen van?
Well, the van was parked alone near the zoo, and I was driving by checking the island at the time, and there's usually no vehicles parked there. That's what brought the van to my attention.
As you drove by, were you in a position to see into the van at all, to see if anyone was there?
Not in the rear of the van, in the cab of the van. It was unoccupied.
By the way, when you say the area near the zoo, let me show you what's been marked as People's Proposed Exhibit number 5. Let me show you what's been marked as People's Proposed Exhibit number 5. Can you describe that?
This is the zoo area on Belle Isle.
Does that photograph fairly inaccurately?
Yes, this is the vicinity the van was parked in.
I move for the admission of Proposed Exhibit number 5, Your Honor.
Back any objection? No objection. Number 5 is admitted.
Did you take any action, any police action, once you had seen this van?
Well, because the van was parked alone, I put the license plate into the computer, and my computer was not signed on at the time, so the license plate did not come back. I had to re-sign on the computer. And at that time, I just totally forgot to put the license plate back in, and I had passed the vehicle at that time.
Can you give the jury some idea as to how much time you spent in the vicinity of that particular van?
Maybe a course of 2 to 5 minutes.
The last I had heard, Zach Baggins, the ghost hunter dude, has like ghost hunter shows on TV. I think he has like which I'd go to the museum. I mean, I'm not a big fan of the guy. I think he's kind of douchey, but he has a museum in Las Vegas, and unless he doesn't anymore and he's gotten rid of it, I'd say not, because he's a collector of a lot of this morbid, weird stuff. I think he has Dr. Kevorkian's van, if I'm not mistaken.
Could you tell us how close you got to the van?
I was in my vehicle passing by, so close enough to see no one was in the front seat of the van on the driver's side.
Could you tell us during this 2 to 5 minute time period that you were there, did you see anybody get into or get out of that van?
No, I did not.
What did you do next?
I continued my tour of the island because I was the only officer on patrol that day. I had some errands to run off the island, and when I returned, that's when I was notified.
When you returned to the island, did you ever see that same white Volkswagen van again?
After I was notified of the situation.
You received some sort of notification?
Yes, I did.
Was that from the police department?
Yes, I was pulling into the driveway and I saw Mr. Fire exiting the station and my inspector and Officer Green along with him. And I was notified at that time.
Who was it that notified you?
Inspector Arthurs.
I'm glad the chat, I jumped out for a second. I'm glad the chat seems to agree that he's a douchebag too, right? Is he not the most douche-tastic fucking nozzle out there? Like, I always hated this guy. But yeah, I'm not a fan. But I would go to his museum, I can't lie. He's got a lot of crazy shit. But I mean, God, I hate the way he's like always on his, he's always trying to like fight the ghost. He's always like, got his little meters and shit in his crew. He's like, are we doing this? We fucking going? Yeah, that's what I fucking thought. Yeah, that's right. Like, it's like, dude, the ghosts are not going to come out for you trying to, like, accost them. Like, let's calm the fuck down, bud. Yeah, I don't like that.
At the time you received this information, you were at the Harbor Master
Station
office? Okay.
Yes.
Inspector Arthurs told you to do something?
Well, I was notified that Dr. Kevorkian was over by the zoo, and they asked me, did I see a white van near the zoo? And I responded, yes, I did. And when I took them back to the area, the van was gone.
Give us some idea, if you could, Officer Banks, what time was it that Inspector Arthurs talked to you about the van?
It was about an hour, maybe approximately 9:40.
Amber is the color of your energy.
Oh. I'm out of water. I went to get some water. I'm not sure if this is the last video or not.
So once you had received that information, did you in fact drive over by the zoo?
That is correct, I did.
And you said the van was gone?
The van was gone.
What happened next?
I started towards Riverbank, which is just left of Central. And I was pulling up to Riverbank and I saw the white van driving down Riverbank towards the bridge. And I beckoned to my inspector to let him know that that was the van that I saw, and I pulled the van over. And Dr. Kevorkian was driving the van.
And when you say Dr. Kevorkian, you're referring to the gentleman at the defense table in the blue sweater and the
Yes.
white jacket?
Saint?
Now, Officer Banks,
at the table,
can you tell us, please, once the vehicle was stopped, do you remember what street you were on at that point?
I was on Riverbank.
What occurred once the van was stopped?
I had to pull alongside of the van to get Mr. Kevorkian to stop, and he jumped out of the van and started yelling, what was the media doing here? What was the media doing here? And I asked him, where was he going? He said, I was going to the police station. And I directed him to that.
Did you, in fact, follow the van to the police station?
Yes, I did.
And was that the Harbor Master station on Bella?
Yes, we were right alongside of it.
Can you tell us, please, it's the Harbor Master office that you work at, is it manned 24 hours a day?
Yes, it is.
Once you got to the Harbor Master station, did you have any contact with Dr. Kevorkian?
Yes, I did.
And could you tell us, please, what was the nature of that contact that you had with him?
I directed him to drive the van to the rear of the building. Once we were at the rear of the building, I got general information from Dr. Kevorkian, such as name, age, just general information, address. And I asked him how long had he been on the island.
What did he tell you?
He told me he had been on the island approximately an hour and a half.
What else did he tell you?
Besides that, nothing really. He was just really upset.
Did he say what he was upset about?
The media.
Were there any media that you noticed?
By the time we had arrived to the rear of the station, I could estimate on how long it took. The cameras were in the bushes and the fences. I would say maybe 15 minutes, maybe.
15 minutes after you got there?
Approximately.
Do you recall whether you had any conversation with Dr. Kevorkian regarding an individual by the name of Thomas Hyde?
That is correct.
What did Dr. Kevorkian tell you about Thomas Hyde?
He told me Mr. Hyde had Lou Gehrig's disease. He had a terminally ill disease, and he had Lou Gehrig's disease.
Did he say anything else to you at that time?
I don't recall.
Do you have your report with you?
Yes, I do.
Looking at that, possibly refresh your recollection.
He stated that the complainant committed suicide inside the vehicle, and the complainant had a terminally ill disease, Lou Gehrig's disease.
Okay. Thank you. I have nothing further at this time.
Dr. Kevorkian didn't tell you where the vehicle was parked when Mr. Hyde committed suicide, did he?
No, he did not.
Thank you. I have no further questions.
Mr. Any other questions of Ms. Banks?
No, thank you.
Ms. Banks, thank you. You may be excused. Is there someone that we could get on and off in the next half hour or so, Mr. Kenny?
Could we approach Judge?
Sure. You're assessing the amount of time and what would need to be done. I'm going to end the matter for today. Keep in mind that I told you we're not going to meet tomorrow on this. We will continue with this on Monday morning at 9 o'clock. I know we had at 9:30 this morning, but Monday at 9 o'clock, I want you to be in your jury room and prepared to go with this at about 9 o'clock. Again, do your best to get here, on time. I know that often there are unforeseen circumstances that get in the way, but try your best to be here on time. Also, keep in mind what I have told you and will continue to tell you and remind you throughout this trial, and that is that you are not to have any contact whatsoever with anyone involved with this particular case. The media persons have been asked not to make any contact with you, and I'm sure they will respect that. And like I said, if you see persons involved with this case and don't say anything to you, they're not being rude or discourteous. They're under my instructions not to have any contact with you also. Again, I remind you about and caution you about publicity in this case. I'm going to read it to you again. You may memorize this before this is over, after you hear it so much. Anyway, during the trial, do not read, listen to, or watch any news reports about the case. Under the law, the evidence you consider to decide the case must meet certain standards. For example, witnesses must swear to tell the truth, and the lawyers must be able to cross-examine them. Because news reports do not have to meet these standards, they could give you incorrect or misleading information that might unfavorably favor one side. So to be fair to both sides, you must follow this instruction. Also, as I cautioned this morning about literature, pamphlets, and so forth, being passed out, advisable not to accept anything like that. If you accept something that seems questionable, I would suggest if you want to look at that, put it away, and you can read it, once you are excused from this case at some later time, but not during the course of this trial. Anyone have any questions they want to ask, any concerns? Okay. Then have a good weekend, and we'll see you Monday morning at 9 o'clock. Remember, you come directly to your jury room here, and remember your badges, okay?
All right, for the jury.
Thank you.
What's the next one out of interest? All right, yeah, the next one's an hour 14. I'm probably going to cut it there. The next one, starting out, is Officers Lonnie Lane and John Green. Detroit police officer Lonnie Lane, an evidence technician, takes the stand, followed by Officer John Green. Wow, what a day, man. Today was pretty powerful, actually. It was pretty heavy. Thank you all for stuck with me, hung out. Appreciate it. Again, week 2 of the Dr. Kevorkian trial. This one, again, is going to go by a little bit further. We're already on video 6 of 26 videos. So this one will probably be about a month, maybe a little bit over a month. I'm terrible with the timing on that, but it's not going to be nearly as long as the Jeffrey Dahmer trial. But wow, yeah, what a day. Appreciate everybody for hanging out today. It's been awesome. One thing that I do want to 100%, if everyone in here would do it right now, it'd be awesome. It'd actually help me out with a little bit of an experiment that I'm working on. So I made a short yesterday, and I put it on Twitter too. You maybe have even already seen it. But it was from a live stream that I did on Friday. On Friday, we did a live stream on the Malaysian airline, the flight that disappeared. But I broke out this very short. I mean, it's like 27 seconds, a short. If you guys could go watch this, give it a like, share it to somebody randomly, get this in YouTube's fucking algorithm and tell them to suck a dick. Bastards not pushing it out. It has like 49 views. They didn't push it out to nobody. They didn't do shit. If you've heard me and Jay talk about the shorts on YouTube, they piss me off is what they do. You guys have been absolutely amazing. Go check out the replay of Feral Friday, though. Feral Friday was awesome. Talking about, again, the disappearance of Flight 370 in 2014. There's a lot of different stuff going on right now. A new guy's out here making a lot of waves about the disappearance and how it looks pretty crazy. The footage is wild. It looks like it went into another dimension. So, Bobby Hansen coming through here. Appreciate it. Had to take a mental health break. Came back at the wrong time. Oh, my God, yes. This was the wrong one for that, Bobby. But thank you so much. Appreciate you. Love you. You're absolutely amazing. I love Ken Shamrock. I'm a big Ken Shamrock fan. I'm not sure why we're talking about Ken Shamrock, but I'm here for it. Jessica, thank you for being here. All the mods, thank you very much. Let's see. Does Jay have a stream set up for tomorrow? Yeah, he does. That's where you're going, folks. Boom. In the morning, you're going to be teleported to a stream on the JBN network. It's going to be a good one. Yeah, the Young Thug trial going on right now has been pretty wild, so you're going to want to come and hang out in the morning with Jay. And also, yeah, the investigators, that's all that went up to. You want me to send them to that one? Would you prefer that one? I can send them there as well. I can't wait for that one, actually. The Investigators is one of me and Dan's favorite freaking interviews. They were so amazing, and they're going to be back. Like, I can't wait. I want to do an all Bigfoot, aliens, like a wild show with them. I think it'd be fun. Hell yeah, nice. Hell yeah. Well, guys, everybody donated today. Thank y'all so much. Appreciate the hell out of it. I will see you back Tuesday. I think it's about time to do a movie or something. What do y'all think? Follow me on kick.com/publiclybuzzed. Do it. And that link, again, go watch that seconds-long short, okay? Again, this is a little bit of an experiment. I want YouTube, and if you don't, whatever. It's all good. But literally, hit this link, watch this, share it out, and hit like, okay? YouTube, fuck you for not sending that out, you sons of bitches. Week 3 coming at you next week. Holiday movie, boom, JB nailed it. Yeah, we're going to be, Scrooge just coming. Maybe that will be Tuesday's movie. That's what, yes, boom, especially today. Today was heavy. Bobby Hansen, take care of yourself. Love you guys. You guys are the best. This has been amazing. All right, I'm really going to do it. Portal time. Later. Have a great Sunday, everybody. Seriously.